Okay, everyone. It's my great pleasure to welcome you all to this virtual forum. My name is Will Hayward. I'm the Dean of Social Sciences at Hong Kong U. And we're really excited to present this forum, to have you join with us. The forum is brought to you by the Faculty of Social Sciences at Hong Kong U, along with colleagues from the Department of Law and also from the Center for the Humanities and Medicine. Obviously, we're here to talk about COVID-19. COVID-19, as we all know, is a global public health emergency, first and foremost. But of course, it has many other effects. In dealing with the public health emergency, we, of course, are all very aware of the economic emergency, which is now enveloping many countries as economies essentially have to close down to deal with the virus. But maybe one that's got less attention is the emerging social emergency around people's responses to the pandemic itself, their anxieties, their fears, their concerns, but also the way that they have to deal with the shutdowns, the isolation, the social difficulty, and so forth. In the Faculty of Social Sciences, we have a lot of colleagues who are working on these issues, and so we thought this would be a great opportunity to bring some of their work and some of their expertise to the wider community. So today we have a couple of sessions. The first session is titled Mental Wellness During COVID-19 Facts and Findings. So that will be moderated by Professor Rainbow Ho from the Department of Social Work and Social Administration, focusing more on research work that's been going on, looking at different aspects of kind of the social response to COVID-19. And then the second session, Supporting Yourself During COVID-19, Tools and Tips, will be moderated by Professor Keith Richburg, who's the director of the Journalism and Media Studies Center. And that will be looking more at expertise that many of our colleagues have on ways that people as individuals, as communities, can respond to the challenges that they face. We're really excited to have a lot of people joining us, either via the webinar or on Facebook. Please, if you have questions, do put those in the chat box, and we have colleagues who will feed them to our moderators, and then we'll make sure that we ask them of the speakers, so we'll try and get some interaction. So I'd just like at this point to thank all the speakers that we have, our colleagues both from within the faculty and outside the faculty, for coming together at quite short notice to present their work and their expertise. We're very grateful to you. I'd also like to thank the faculty team who have worked tirelessly to put this on. So I will now hand over to Professor Rainbow Ho and ask her if she will lead us through the first session.
Hi, thank you, Will. Good afternoon, colleagues and friends. But before we start the presentations, I would like to remind the audience that if you have questions, please type them in the Q&A box. Your questions will be answered by the speaker in the box, or maybe addressed openly at the end of the section. So we will not have the Q&A after each presentation due to the limitation of time. So I would like to start this section by introducing the first speaker, Professor Xiumen Ng. Professor Xiumen Ng is a professor in the Department of Social Work and Social Administration. He's also the Associate Director of the Center on Behavioral Health. He has background in both mental health social work and Chinese medicine. So he will be sharing with us about the mental health of adults in Hong Kong and mainland China. Professor Ng, please.
Thank you so much, Professor Ho. Good afternoon, everybody. It's my great pleasure here to share our research findings on the mental health of adults in Hong Kong and mainland China during the COVID-19 outbreak. So since some of you may not be familiar with what is normal, what is abnormal in relation to our responses to trauma and stressful events. So first of all, I need to provide you some very basic knowledge on this topic. So to answer this question, we need to look at different time points. Number one, during the incident. Number two, shortly after the incident. And number three, the longer term outlook. So during the incident, for example, if we are trapped in a building in fire, there will be huge individual difference. Okay, some of you can function normally and remain calm. Some of you may simply collapse. And then in such situation, the notion of normal versus abnormal would be irrelevant. Okay, so we don't consider that. And then shortly after the incident, say for a few days or a few weeks, so most people will develop a set of symptoms, so-called the critical incident stress, that would include like intrusion, usually by means of nightmare and flashback, and also intrusive thoughts, avoidance behavior, increased arousal, anxiety symptoms. But anyway, many experts would consider this set of symptoms as normal responses of normal people to abnormal situation. Okay, and then how about the longer outlook, say over a month? Okay, so if the so-called critical incident stress persists and also affect the normal functioning of a person, then we may consider the diagnosis post-traumatic stress disorder, PTSD. And there are also a number of other mental disorders that can be considered, including adjustment disorder, depression, anxiety, hypochondriasis, and also some physical somatic functional disorder, okay, like functional GI disorder such as irritable bowel syndrome. Okay, but many people would overlook that actually most people would recover. And actually some of them will have post-traumatic growth. So we will talk more about that later on. Previous studies tend to focus more on a psychopathological perspective. So especially there are lots of studies looking at PTSD, post-traumatic stress disorder. But more recent studies tend to also include a growth perspective. Okay, so that is in line with our traditional Chinese wisdom. So when we call ai gai, ai is also gai. So crisis is also opportunity. So more recent studies find that trauma can also lead to post-traumatic growth. And then conceptually, there are 4 domains of post-traumatic growth, including about ourselves, interpersonal, spiritual, and also life orientation. And in face of life-threatening illness, previous studies have revealed that people would be at higher risk of PTSD, especially those who have poor social support and also have unpleasant experience with health workers. And in our 2003 SARS outbreak, there is a study revealed that the prevalence of PTSD among Hong Kong people is like between 13 and 18%. But the studies on PT, post-traumatic growth, are rare. So COVID-19 pandemic is unique in the sense that it has a high transmission rate and a high percentage of severe cases, we're talking about over 10%, and also a high death rate. It is a worldwide health emergency, and the lockdown has been extensive and also prolonged, and also it is highly politicized and a lot of fake news around. So it's not just an epidemic, but also so-called an infodemic. Okay, so that really causing a lot of mental health burden on many people. So now coming back to our study. So we want to look at the mental health of adults in Hong Kong and mainland China during the COVID-19 outbreak. And we look at both PTSD and PTG, okay? And we adopt a multi-wave internet survey as our design. And so the study is still going on, but at the moment, we have the China Wave 1 data, Wave 2 data. The Wave 1 was conducted in the second half of February. Wave 2 was conducted in the second half of March. And at the moment, we have the Hong Kong Wave 1 data that was conducted at the second half of March. And we have, the below are the technical stuff about our measures for estimating the prevalence of PTSD and also PTG. So here are some a summary of the important findings. So first of all, about probable PTSD rate. So for trial, wave 1, the estimated rate is really high at 36.1%. And then for wave 2, the rate went down to 25.3%. And for Hong Kong, the wave 1, the estimated PTSD rate is at 28.6%. Okay. So what are the major risk factors? So we come to that part by means of stepwise multiple regression and also binary logistic regression model. So for China, the risk factors include past experience of major disaster, having a chronic disease, and also suffering from shortage of daily necessities. And then for Hong Kong, the risk factors include having a chronic disease, live in a building with confirmed cases, or unsure if there was confirmed cases in my building, and also a lower household income. So somehow these risk factors are expected in some way. So here are some more interesting findings. So these are more so-called counterintuitive, but also very inspiring. Okay. So in our Chinese data set, okay, so we didn't find any gender difference. So that is different from the findings in previous studies. And we also found that helping professionals, they actually showed less post-traumatic stress and also less negative affect than non-helping professionals. So that is something very interesting. And also we found that the low-income group actually showed less post-traumatic stress and negative affect than higher income group. But of course, provided, okay, the basic necessities are sufficient. And also the respondents from Wuhan, the epicenter of the outbreak, did not show more post-traumatic stress than respondents from other parts of China. And instead, they showed more positive affect. So these are some interesting and worth further deliberation on the reasons behind. Okay. And then how about the post-traumatic growth? Okay. And we view a really high post-traumatic growth figures. So from our China wave 2 data, so 47.4% among our participants, they showed the PTG in at least one of the 4 domains, 21.1% in one domain, 14.2% in 2 domains, 12.1% in 3 domains. Okay, that is wonderful. But the interesting point is that none of them saw a post-traumatic growth in life orientation. Okay, so life orientation is about rearranging our priorities in life. Okay. And how about the association between PTSD and Ptg? And again, the finding is a little bit unexpected. Okay, the correlation is positive. Okay, so we would expect a negative correlation between the two, but it's actually positive. But anyway, the magnitude is very small. So practically, we may interpret that PTSD and Ptg are largely independent to each other, and they can coexist. So predictors of Ptg, and again, the findings are rather inspiring. So the predictors include gender being women, age being more mature, higher education, and then Wuhan actually is a predictor of Ptg. So that is something very interesting. Those people living in the rural area tend to have more Ptg. So out of our expectation, shortage of daily necessities is also a predictor of Ptg. Okay, having a chronic disease, not leaving home at all, close relationship with family and friends, have received that help from government or social services, and also perception about pain and gain, and they really agree the notion low pain, low gain. So summing up, it seems to suggest maturity, tranquility, sufferings, gratefulness would lead to Ptg. So that is the final slide, discussion and implications. So number 1, we review a high probable PTSD rate. but we need to consider the context. So this is a very special context, COVID-19 pandemic. So to some extent, all these are just normal responses of normal people to abnormal situation. So we should avoid overly pathologize, don't over-interpret, and don't exaggerate the situation, okay? And in parallel, we also review a high Ptg rate, okay? And our findings seem to echo the traditional wisdom of low pain, low gain, okay? And also regarding intervention, for example, psychosocial debriefing. So currently, the CISD is the most popular model to provide debriefing, but which focuses on symptoms management, okay? So our findings suggest that actually we should also facilitate meaning making, growth, and transformation. So here is an example. Our work after the 2003 SARS, we actually developed a more comprehensive psychosocial debriefing model, and we call it strength-focused and meaning-oriented approach for resilience and transformation, and we call it the SMART approach. So that's it. Thank you so much. I hand over back to Professor Ho.
Thank you very much, Professor Ng. So we will leave the question if you have at the end to the end of the section. So may I now introduce you the next speaker. We have Dr. Johnson Chen. Dr. Chen is the associate professor in the Department of Psychology, and his research interests are social psychology and cultural psychology. So today he is highlighting the social exclusion during the pandemic of COVID-19. Dr. Chen, please.
Thank you, Professor Ho. So I'm going to talk about my recent project, a couple of studies on social exclusion. So we know humans, we live in groups, so we want to be liked from the, even after we were born. Also, this happens in human evolution. So we survive in group, we always work with others. We also become very sensitive and detect a very minimal cue of exclusion, and we constantly monitor how we get along with others. Even this minimal cues of exclusion can make us feel quite uncomfortable. Now, the literature has is a very large literature. We have seen all kinds of consequences of rejection or exclusion. Because they, from the evolutionary point of view, altruism equals death, because you cannot survive alone. Because of this connection, it's fairly, the impact of on us is very profound. So I'm going to share a very, I think this is a very popular framework to understand the outcome of rejection. So basically we are fairly, we start with detect different kind of cues or signals. So even, there's a minimal signals can trigger this feeling of pain. A lot of times we can do this unconsciously. Also we can feel sad, anger. Also in this framework, the core is on the need threat. So we have this all kinds of fundamental human needs to belong, for self-esteem, for control, and also to seek a meaningful life. When we are ostracized, so these threats, various fundamental needs we desire. So basically, this will, when these needs are threatened, that will lead to a second stage or reflective stage, which is to trying to to fortify or to boost those threatened needs. Depends on the how different kind of needs are threatened, that will also influence how we respond cognitively and also behaviorally. For example, if sometimes we are not liked, we're trying to behave better. We're trying to gain more attention or trying to monitor our behaviors better. But other times when we are rejected or ostracized, we become so mad, we vent our frustration, or we even lash out to be aggressive. So these are various different types of behaviors people can engage in following ostracism. Now, ostracism doesn't, rejection doesn't happen in real life. They can happen for a fairly long period of time. Sometimes we feel like we're rejected, people don't really like us. We tried all kinds of things trying to gain their favor, but that doesn't work. And also this kind of treatment continues. This persistent rejection or persistent altruism can have fairly profound, negative outcomes on us. Those includes a feeling of alienation. We can feel depressed, and also can feel helplessness and unworthiness. And also, we could feel, have suicidal thoughts. This is a recent paper published with my colleagues. So we find that, when people feel rejected, this can trigger suicidal thoughts. So this is the idea that, when we feel we are being rejected by others, these thoughts of suicide come to us more easily. We probably think about the death of our own or even about others. Now this was explained by the mechanisms of meaning in life. Also because altruism, impacts very, our desire to seek for meaning. So when we see less meaning in our life, we are much more likely to think about death. So that is basically it's this is an individual project. Now come back to COVID-19. So this is a very unusual case. Because during the lockdown of various places on the planet, we feel much isolated than ever. So the cities became empty, and also we often we work alone at home. So we can't do this like what we're doing now through communicating with others online. But it's also a new form of communication. People are trying to get used to what's going on. Also during the process, there's so much going on. In the early stage, we were talking about masks, whether it's appropriate to wear it. People who wear masks could be ostracized or rejected by the society or their community in the early days. Although now it seems like we have a much more consensus about what to regarding wearing masks. But these issues has been linking on, and also it's very sad to see there are all kinds of incidences of discrimination, xenophobia, racism, and attacks against people who scapegoat for this spreading viruses. Also, people express this in very different forms. Some are very explicit, some in much subtle way, but it's a fairly we see this much more than we used to. So this presents various problems in our current situation. So not only it leads to for people who are the target of altruism, they probably suffer various consequences of altruism or rejection, but also for people who are not yet identified as as a carrier of the viruses. This can inhibit their desire to get tested, because people don't want to be identified. So even when they are identified, they do not want to reveal their identity. So this became a fairly complicated issue, and also I think the implication it has a fairly profound implication on how we deal with the current COVID-19. So I'm going to present 3 studies. Now the first one really is on trying to see the consequences, the mental health consequence on people who are ostracized during this period. Now the first study, we were looking at people who live in Hubei province. So this was a period when when this is still the primary place where the virus was reported. So basically so we look at people in China. So basically the Chinese who are outside of Hubei province, how they view or look at people who live in Hubei. So we captured a few variables. So one of them, the major variable we are trying to look at was their perceived exclusion. Basically, is how excluded they feel during this period of time. Now, this includes the feeling of exclusion from the society, from the community, also from their close others. Now we came up with 12 items, so the correlations are quite high, so we basically put them together as an overall index. Then we also measured the perceived vulnerability to COVID-19. Further, we captured the anxiety, depression, and also the negative affect. The anxiety, depression was captured by this Chinese version of the hospital anxiety and depression scale. So basically, it has two subscales. One captures anxiety, and another subscale captures depression. Then we have a separate measure on negative affect. So our question really is, this feeling of exclusion people feel. So during this period of time, how much, where does it contribute to our health, mental health, beyond the fear over COVID-19, over the virus. So basically we ran a fairly simple regression test. So we find people's concern over the virus did predict their anxiety, depression, and negative affect. This is not a surprise because this is what people perceive. This also makes a lot of sense. What we are trying to test here in this study was the second part, which is when you control for people's concern over the virus, whether that will still whether the exclusion will have an effect beyond this concern over the virus. So in the study, we did find social exclusion, the perceived exclusion, have a significant role in predicting anxiety, depression, and the negative affect. So that's the first study. Basically, we're trying to show the social exclusion people experience. It's a fairly robust and important factor in understand people's mental health. Now, so we, as I discussed earlier, so there was a lot of exclusion going on, a lot of this, racism. These not only are in the, happening in daily life, but also happen a lot online. People feel, a lot of people, they do things or say things they normally won't do. Now, the reason people cited in these situations really about fear over fear of COVID-19. So basically the idea, because of a virus, we're trying to protect ourselves, we want to, exclude you, or we say things that, can protect us against the COVID-19. So that's the reason people feel legitimate to do so. So the question I'm asking, with my collaborators, we are very interested in, whether this is really, there's a fear over COVID-19 can explain all this exclusion or all these, explicit behaviors we observe online and in daily life. So we ran two more studies. So in these two studies, we basically trying to look at what predict this exclusion beyond people's concern over COVID-19. Now, in the first study, this study 2, so this is a study done in mainland China. So we recruited participants, across the nation. Now we assessed various individual differences, like the materialism. Basically, this is how much value, how much people favor materialistic possessions. I think about personal success equals to materialistic possessions, or equals to wealth. Now also we may capture the sexual dominance orientation. This is the idea, people are different. Some people are simply better than others. And then also we measure the system justification people holds. So this is the idea. Sometimes people justify what is observed in society, even if it's unfair. So a lot of times we experience a lot of things in our life, whether people will think the system is fair to justify their own or others' unfair treatment. So we think, these variables, they are fairly powerful in predicting people's behaviors. So they should be able to predict this, what we see, so much exclusion we observe beyond people's concern over over COVID-19. So we measured people's perception about the COVID-19, and also we captured their exclusion. So basically, this is the idea how they would treat people from Wuhan. So basically, that's the idea. This is a group of people who are fairly dangerous. Whether I would avoid them, I would exclude them. So what we find was consistent with our prediction. So of course, we see our perception about the virus predicts people's exclusion towards people in Wuhan. But also, those individual difference variables, they also have a role to play. So each of those individual differences variables is able to predict exclusion beyond people's perception about the COVID-19. So I think this is very interesting. It's a very interesting study that basically speaks about there's something more going on than people's concern over the virus. This is at a global level. We see all kinds of exclusion going on. So in the next study, we try to replicate this in US. So this is we are looking at people basically how people think about the Chinese. So we decided to measure social exclusion in a more systematic way. So we capture people's attitudes and also their affect and also the behavior towards Chinese. So basically, this is the idea to capture how people feel like they want to exclude or they feel legitimate to exclude the Chinese. Now again, in this study, we assessed, as in the previous study, we assessed their materialistic thinking, their system justification, and also social dominance orientation as individual difference variables. And also we assessed their perception about COVID-19. So in this study, again, we find that there's an indicator that people's exclusion against the Chinese in US is beyond their it's not just a perception about the virus. So certain beliefs people hold, or certain ideas people have, they are powerful predictors. So seems like the COVID-19 or the coronavirus triggers or lead people with certain beliefs to behave in a fairly detrimental way or aggressive way towards other groups. So I think this is apparently this is a line research. Probably we need a lot more effort to pursue this line of research. But I think the message, what I'm trying to get at, through the studies, the message is quite clear. They are the virus. Certainly, we are all fighting this virus. But regardless of what's going on with the current virus, there's still human rights. So it's not about. It doesn't give us a legitimate reason to attack or to exclude other groups or people. So that's all for my presentation.
Thank you, Dr. Chen. So Dr. Chen mentioned about autism may lead to suicidal thoughts. So I think it is a good time to listen to the next speaker, Professor Paul Yip. Professor Paul Yip is the director of the Hong Kong Jockey Club Center of Suicide Research and Prevention, and the chair professor in the Department of Social Work and Social Administration. Professor Yip's research interests focus on suicide prevention and promoting well-being in the community. And he will share with us his experience of helping students from deprived families amidst of COVID-19. Professor Yip, please.
I think in the COVID-19, I think we have been talking about the social distancing, I think everywhere. But this social distancing, sometimes, I think it will lead to some disconnection, I think, in the community that we would like to try to avoid. What we have seen, I think the park has been closed. I think the library has been closed. I think the swimming pool is closed. I think the sports ground has been closed. It has caused quite a lot of disruption, I think, in the life of many Hong Kong people, especially the deprived, the older adults, all those people, I think, from the low income groups. Now we can see also the Hong Kong economy challenges under the COVID-19. We see an increased number of the closure of the shops, the reduction of the salary. I think that has been caused a significant pain, I think, to the community. And then what I just said, I think in the COVID-19, I think we see the widening of the gap between the have and the have not. I think even with reflected the Zoom teaching, I think for those people who have a better computer, I think they will have less trouble, I think, to get online. And now also we see the face mask divide as well. I think for the low income family, I think they have to queue up. I think they have to buy the face mask. And also the quarantine measure, I think we see the closure of the public facilities, the disruption of the services, I think the cancellation of the hospital visitation, and then the church services. Some of the activities are the lifeline of many people. So what we see, the social distancing, I think has caused a lot of disruption. And what we say, the social distancing, what we see is not only a physical, it's only the physical distancing. Unfortunately, because there's no alternative support has been making available, and that's caused the increased level of anxiety, sadness, the anger level in the community. When we talk about anxiety, we talk about the uncertainty, and then the sadness is about the death and the impact, I mean, to many families locally and abroad. And also the anger, sometimes it shows towards the government's slow response, and so some racial discrimination against the mainlander as well. We do a social sentiment, I think, to monitor the social sentiment of the people in Wuhan and also the people in Hong Kong. I think when we're looking at the data from the Weibo, and then what we have seen, I think that there's a substantial of the negative sentiment. I think it has been viewed in the social media. And also when you're looking at, to compare with the Golden Forum, I think in Hong Kong, I think we see the anger itself. It seems that I think it is much more preference, I think, than in China. However, I think in Hong Kong, we should be able to do better because we have the 2003, we have the SARS before. I think we should have learned something. I think in 2003, I think SARS lasted for 3 months. I think we are talking about the 2,000 infection, 298 deaths. In the COVID-19, so far we have more than 1,000 infection, and then we are fortunately, I think we have only 4 deaths. But during that year, what we have shown, we have a high suicide rate, which is at a historical height. We're talking about 18.8 per 100,000. And with the highest rate and increase among the older adults. These are the most vulnerable and because arising from the social distancing. And also we have 20% higher than in 2002. Based on our chronic death file investigation, we saw that social isolation induced a lot of anxiety, loneliness, and fear of contracting diseases, and also the cancellation of the medical appointment, and that have an impact, I think, on the mortality of the population. And also we see a high unemployment rate as well, which is 8.6% in 2003. Based on our study, it has been shown that if you have an unemployment, I think your suicidal risk is about 8.65 times higher than those people who are employed. On the other hand, when we look at the social support, I think if you do have the social support, I think your suicidal risk is 73% less than those people who do not have the social support. So that is the situation, I think, in the suicide rate when you look at from 1997 and up to 2018, and then we have the historical high here. But it actually, since 2003, we have experienced a very encouraging decline. And then we just, hopefully we just have to work harder, I think, to prevent, I think the suicide rate will go up again. Now we also see the distribution about the poverty and how does it related to the mental health. This paint in color, these are the region, I think, who will have the higher suicide rate, I think, than the general population. Now this area is mainly in the northwestern part of Hong Kong, and this area also have a high preference, I think, of the poverty population as well. So based on these challenges, what can we do? So in our faculty, I think with the Center for Suicide Research and Prevention, I think we have worked with the NGOs in the community and then try to come up with some good practices. I think they're helping those in need. We're talking about connecting the disconnected using the social media. Because during the school suspension period, I think it has caused a lot of challenges, not only to the teachers, to the school children, and also to the family as well. And also what we like to do is to provide an opportunity, I think, to have an alternative learning experiences for our school children during this suspension period. So we work with a parental, this parenting Facebook platform called Mommy Share, and then we have gathered a group of celebrities in the community, I think, who contributed to the daily program. So every day at 4 o'clock in Facebook, they have the live stream, and then they provide an alternative learning experiences. We have done the game share, story share, the yoga share, music share. It's just to have a bit more fun, I think, during this period. And actually, I think the coverage, the reception, I think it's very encouraging. We also, in our center, I think we have provided some sort of this materials, I think, for the parents, I think, to make use of. And also we know that there's a lot of fake news, I think, in the community. So what we have created is a Dr. Safari, I think, the mailbox, and then we invite, I think, the community, I think, to post us any question. And then we try to provide them an answer, I think, within the 48 hours. So I think that what we're trying to do is for this and try to connect these disconnected people, and then just to let them know that they have not been forgotten. And then we provide a platform, I think, to be engaged again. There's another study, what we have been doing is a pilot study called We Share, We Can. As you might know, I think the government, I think, has promised, I think, to give us the cash handout, $10,000, I think, to every one of us. I think they start to distribute the money in June. And what we did, I think we have gathered about 35 people, I think, to engage in this pilot study. I think they have agreed to pre-donate, I think, that $10,000, I think, to the needy student. And what we like to find out is what is the impact on the happiness level of this individual who donated money and also those households who received the money. And also we also like to find out how are they going to spend the money and also the reason why they would like to participate, I think, in this pilot study. And then the participant, I think we have identified this needy student. I think that all of them, they are recommended by the school principal, and then they are matched by the donors. So the donors know exactly who would, where and whom the money has been spent. And also we try to make the connection. The connection is just the student who received the money, I think they will show the appreciation. I think they write a thank you card, I think, to our donors. So for this two group of people, I think we have asked them to fill in a questionnaire, and then we will ask them, hey, how would you spend your money? I think that $10,000. So I think for the donors, they say that they will spend on saving, gift, entertainment, and the holiday expenses. But for the beneficiary, for those people who receive this donation, I think they will spend on the food, the housing, the electricity, and gas, and water, and the transport. So in a nutshell, we are talking about these donors. I think they are spending on the expendable item. They are not these are the consumer item. They are not the essential item. For the so-called this beneficiary, I think they have more need. They will spend the money on the essential items. Then we will ask the donor, why would you donate your money? So I think in Hong Kong, we do see a lot of altruism, I think, in our community, and then they believe that 85% of them, they believe others, they need it more. And also there's 50%, I think they believe that by doing this, I think they utilize the government handout more effectively. I think the most exciting thing of this pilot study is about the happiness level. We like to find out what is the added value of this $10,000 to the donor and the beneficiary. So in our survey, we asked them in the past 12 months, what is your happiness level? So for the donors, for those who have responded to our survey, I think they are somewhere in the middle, 5.2. But then when we ask them, when you know that you're going to receive the $10,000 from the government, I think what is the happiness level? It gone to 5.6. Well, that is making sense too. No one is complaining to have received some money. But when they know that they have sent the money to the poor student to participate in the We Share, We Care scheme, the satisfaction level has gone up to 8.2. Let's look at the beneficiary. Those people, when they ask, what is happiness level in the past 12 months, there's 5. Now, it is interesting to see the donors and the beneficiary. There's not much difference. So actually, money not necessarily will make you a happier person. But of course, we ask them, what happened to the government? If you are going to receive the 10K, and then what is your satisfaction level? Now, it has gone up significantly, 7.7. Of course, these people, they do need the money. And then after that, we have told them that, well, you have been recommended by the principal that you're going to receive, I think, the $10,000, and then the happiness level has gone to 8.3. So this is the 35 people, I think, who have volunteered, I think, to participate in the study. But I also like to play you the video.
Hello, I'm Christine Lowe. I'm currently teaching in the US temporarily. I've heard about the news in Hong Kong, and I know how many people are suffering at this very difficult time. The government is giving us $10,000, and I think if you don't really need it, perhaps we can all donate this sum of money to causes and people who are in much greater need. I'd be happy to do it, as are many of my friends. I hope you will join in and do the same. Thank you so much.
我係 Will， 我住喺澳洲嘅墨爾本。咁今次呢個疫情，我知道對好多香港嘅家庭都帶嚟好大嘅影響。雖然我唔係香港，但係都想出翻一啲力。咁希望俾我更加需要呢筆錢嘅人可以得到幫助，亦都希望更加多人可以響應今次嘅籌款。
您好，我是香港大學社會工作與社會學系的助理教授汪淑華。請問您和我一樣從外地來香港工作，關心一些家庭如何在疫情中度過難關嗎？有一些家庭比我更需要這1萬元，請支持 We Can We Share 轉贈愛計劃。
The interesting thing about these 3 people, I think that the Dr. Will Lee, I think he is an ex-Hong Konger now living in Melbourne, and he himself also feel a bit strange, I think, to receive the money from the government. But now he has an opportunity to contribute. And then the last one is our colleague, I think Dr. Cheryl Wang, although she's not entitled to receive that amount of money, but she also feels that there's a greater need in the community that we all can contribute. So now the We Share Weekend, I think this campaign has been taken up by the Lok Sin Tong Society and also the Project Weekend. So the program is on now. They are inviting the application, and I think if you know somebody who do need this amount of support, I think do contact them. So I think the takeaway message, what we see, the donated money to others who need the money can increase his and her and the overall happiness of the community. Now, without this sort of program, you can see the people, their happiness, it will be only 5.6 and 8.2. But after you redonated the money, it had become 7.7 and 8.3. So it is a win-win situation for everybody. And secondly, the social distancing has unintended consequences. And then the mental health support should always be part of any quarantine measure. And the mental wellness is often something being overlooked in any epidemic quarantine measure. And what we found out that the social and financial support during the epidemic is very important, I think, to the needy family. And thank you very much for the opportunity, I think, to share some of the work, I think, to the community. Thank you.
Thank you, Professor Yip. So I think I now turn it to the next speaker, Dr. Cheryl Choi. So Dr. Choi is the assistant professor in the Department of Social Work and Social Administration. And her research focuses on the intersection between social policy sector and the well-being of vulnerable population groups. Today, Dr. Choi will share with us the topic about mobilizing community assets and humanitarian technology during the public health crisis, a social innovation response to COVID-19 in Hong Kong. Dr. Choi, please.
So as everybody know, we're in the midst of a public health crisis globally. And just now, a lot of the speakers have highlighted how, especially Professor Paul Yip, that this COVID virus affects disproportionately so vulnerable population groups at the first place. So today I will, because of time limit, talk about why Project Ultraviolite was incepted, what was the design principles behind this, and what was first the recognition of the problem. So as everybody knows, Hong Kong is one of the densest cities in the world. We live in an area of approximately only 1,100 kilometers square, but with 7 million people. But we also have one of the highest income inequalities in the world, with the Gini coefficient of about 0.473. Even after some of the income and CSSA transfers, a lot of people still remain in poverty. So what this leads to, and why is it related to public health, is because we know from a lot of experience and literature, it all shows that disaster-like situations disproportionately affects low-income groups because they have perhaps less capacity to withstand such external shocks. So it leads to gradients in terms of health outcomes, in terms of the ability to purchase, say, sanitary or disinfectant products. And it also leads to, in the Hong Kong context in particular, when we talk about social distancing, the premise is that you have distance to be able to practice social distancing. But how is that possible in such an overcrowded environment? So we targeted subdivided units in Hong Kong because we know, everybody knows that housing affordability is one of the primary reasons of discontent in Hong Kong. Right now, currently there's about 100,000 families who are living in such subdivided units, and with the median per square floor here, these are pictures that we took throughout this project, documenting how the hygiene conditions and as well as a lot of safety and unhygienic conditions, because they are a lot of them are illegally reconstructed. So the risk of infection is very high within these subdivided units. And again, I highlight the social part of the pandemic. It's because when we say the supply of masks or disinfectant products are available, yes, but we also have to account for the affordability amongst low-income groups. Yes, there's supply, but whether or not they can access and afford it is an entirely different aspect within the entire ordeal. So we have identified the problem. We targeted families living in these subdivided units. So what can be done is the next step, right? So Project Ultraviolite, we wanted, first I'll talk about what we intend to do. So we wanted to design a prototype using existing ultraviolet technology. And I wanted to highlight this part is because a lot of the social responses so far have been conducted in silos. So different sectors in society have been working tirelessly to play to the expertise, but there is a lack of interdisciplinary or cross-sector responses towards these, any identified problem. So what we wanted to do was to actually bring together experts from different cross-sector fields in order to play to each of our strengths and collaborate in a way that could be effective. So in this Project Ultraviolite, we wanted to provide free disinfectant services to 1,000 families living in the subdivided units in Hong Kong. And this project was actually funded by the Hong Kong Jockey Club Charities Trust. There's an emergency fund that we had applied and gotten the grant from. And why disinfectant service? And it's because, as I said earlier on, affordability and also the tight, very crowded area space. So we wanted to address these two problems. Through the disinfected surface, we also wanted to provide psychological support by our social workers as well as medical practitioners who are all a part of this project. So this is currently going on in real time. The implementing project is very simple, simply that eligible participants can sign up of the project, and then we have trained a group of volunteers, later on I'll talk more about it, to go up and to these subdivided units and provide the disinfected surface. The entire intervention takes about approximately 30 minutes to complete, depending on the size of the units. But I wanted to highlight the actual design principle of Project Ultraviolite. It's actually stemmed from two main theoretical driven design principles. So the first is from a very social work perspective, the ABCD approach, the asset-based community development approach, which is the idea that despite their vulnerability in the first place, we can always identify existing assets and capital within each community. So the problem is currently some of these capitals and assets are dormant. They're not mobilized effectively enough to respond to a social need. But from this ABCD approach, our imperative is not to highlight, we already know the deficits and the needs and the vulnerabilities, but what could be utilized better in terms of their strengths. So this is the first theoretical background that guided our design of this project. And the second principle is from a very socially innovative approach to addressing this societal problem. As they say, there's nothing new under the sun, but social innovation actually refers to a process where it includes a new way of mobilizing resources. It could be existing resources, but using it in a new way. So social innovation is actually very complementary to the ABCD approach. So these are the two theoretical backgrounds. And I wanted to highlight the parties that were involved. So first of all, we had a very interdisciplinary cross-sector approach towards the project. So there are academics, social workers, engineers, as well as medical practitioners and community organizations that took part in the project and worked very closely together. In terms of social innovation, we actually had product innovation. So later on, I'll show you the actual prototype of how the device was created using locally sourced material in openly sourced technological fields. We trained materials. So training materials were all developed together. It was a very difficult process at the very beginning because we had to agree on different types of principle. But the first is really all of us agreed on the fact that any proposed solution must make use of existing resources. So very much in alignment with the ABCD model of looking at solving societal problems. The third asset that we identified is that we had trained over 70 volunteers to carry out this research and this intervention. And I might point out that it's interesting because a lot of the volunteers actually they live in these subdivided units themselves. So there's a mutual help spirit going on. And then all the volunteers contributes to the design and carrying out of the project. So they helped us give us feedback while we are doing the intervention in real time, because they're the ones we believe that whoever that's in the situation is the expert in whatever situation they're in. So we constantly, from a bottom-up approach, try to design this project. A little bit of technicality for those who are not for social science people. Actually, the first idea that we wanted to use, why we use UV light, it's because actually this technology has been around for over 70 years. The engineer in this project had explained that it has been used in a lot of hospitals and water filters as well as air filters. And what we usually see actually is for disinfectant purposes, that could kill up to 99% of the viruses and bacteria belongs to this red square here, 200 to 300 nanometers. So this is the first strength, that there is already a known technology that has been around for years, but just hasn't been utilized in this way to target the needs of vulnerable population groups. So this is the first asset that we knew. So what did we do with it? So we knew about the technology. So we set off to work, working with a group of engineers. We mass 3D printed a lot of these, what we call the prototypes of the UV light itself using existing technology. And all of them are affordable and openly sourced and locally made. Second asset that we identified, as I said earlier, we used existing resources, which we partnered up with the community-based organizations, which had already a very strong inherent connections with families living in subdivided units, as well as a very large pool of volunteers. So amidst a lot of disaster situations and crises. Just now, Professor Paul, you talked about the sense of altruism. So lots of people actually want to contribute to the fight against the virus, but don't know where to turn to. So luckily, this project was, we didn't have any problems recruiting volunteers. And actually, a lot of the people living in SDUs volunteered themselves because they wanted to help the neighbors. They know that there are a lot of anxiety concerns regarding those who live in subdivided units. So we trained the volunteers to first operate the ultraviolet, and secondly, while they operate the ultraviolet, another volunteer helped do research in terms of the impact assessment, as well as some general and simple questions about the mental health and well-being. A little bit, so the design principles second I wanted to talk about is that any proposed solution should be affordable, scalable, and easy to use. And why humanitarian technology coupled with social work is a good combination is because we are always aware that some of the proposed solution that the government or other fields working in silo may have is usually catered towards middle class or above. Okay, so yes, if you have money, you could purchase sanitation products and whatnot, but we need to a solution that could be scalable and easily affordable and replicable, so that it could benefit not just those who can afford it, but actually the most vulnerable people in technology in society. So you could see here that why we designed this prototype is what I think is a good solution because it's effective. It takes simply up to 30 minutes to disinfect the entire SDUs, the subdivided unit. It's very portable, so I can carry it myself. It's very light, okay, and it's existing technology that has been used for over 90 years. The light itself can touch really difficult places to reach within the SDU units. And don't forget that a lot of people living in these subdivided units are older adults. So they may not be physically capable of climbing up and down, crawling into dark spaces to clean their own spaces. So we took into account all these factors. And actually the UV light, because the nanometers is strong enough, it's actually very harmful to the human skin. So we actually developed an app that could be remotely controlled. So everybody has to leave the house in order for the light to be turned on and perform its disinfectant service. Okay, so principle 3 is that any proposed solutions must be accepted by the public and it's context sensitive. So what I mean by this is that we actually included people living in the SDU units in the design process, so that anything that we propose is context and actually respond to the actual needs. So this is the 3 principles that we adhere by. On your right, you could see the blue light on. That is the actual prototype, and we have over 70 so far. that is now performing the disinfecting services. And on the left, this is when it's not turned on in the bathroom that you could see. Yes. So future development, I'll end here, is that we plan to develop over 300 ultravioletes at the end. And these actually could be, as I said, from a socially innovative approach, it could be scaled up into catering to different needs. For example, the light can be now installed in institutions like care homes or shelter workshops for people with disabilities. On the research side, there's always a refinement process, and as well, we're doing impact assessment as we speak. And last slide now, because I know I'm running out of time, is that the project actually really highlights how marshalling and integrating cross-sector interdisciplinary knowledge and skills is actually a very good way to resolve any societal problems or answer to any existing problems within from a socially innovative approach. So combining existing strengths and resources, but in a new way, a new form of delivery. And I hope that this presentation will highlight some of the key principles that could guide future academics and practitioners with new insights and designing solutions in the fight against this pandemic. So thank you very much for listening to me today for the talk. Thank you.
Thank you. Thank you very much, Dr. Choi. So here we have the last speakers. For this presentation, we have two presenters, Daisy Zhang, Ms. Daisy Zhang, and also Dr. Eric Yip. Ms. Zhang is an assistant professor in the Department of Law, and also she is the Deputy Director of the Center of Medical Ethics and Law. And Dr. Eric Yip is an Associate Professor of Law in our Department of Law. And before he joined Hong Kong U, actually he taught at University College London and also the Chinese University of Hong Kong. So please, Dr. Yip and Ms. Zhang.
Thank you, Professor Ho. So good afternoon, everyone. We're very happy to be part of this very important forum, considering solutions and strategies for coping with COVID-19. My name is Daisy Zhang, as Professor Ho has said, and I'm here with my colleague and co-presenter, Dr. Eric Yip. We're both from the Faculty of Law, and today's presentation will be taken from a paper on the COVID-19 lockdowns that we have recently developed and is currently under review. And a shorter version of the piece, for those who are interested, it's for a lay audience, is accessible at the Journal of Medical Ethics' blog. So first, a little bit of background about what we're going to be talking about. So as we all know, countries all over the world have been grappling with the explosive surge of COVID-19, with healthcare systems in many of these countries having been stretched to the brink of collapse. Now, this global public health emergency has given rise to a strong perceived demand for states to take drastic and draconian liberty-limiting prevention and containment measures, despite the fact that most of these states are signatories to a range of international human rights instruments. Now, one measure that has been widely used is what has become known as the lockdown. And in its contemporary form, this lockdown might be said to be an invention of China when in January 2020, it suspended the public transport system of Wuhan, the epicenter of the outbreak, and then imposed a stunning, unprecedented lockdown of almost 60 million people in Hubei province. Now, other countries, even liberal democratic ones, have quickly followed suit. After Italy became the first European country to impose a nationwide lockdown on its entire population, the lockdown was used by countries like India, Spain, France, and the United Kingdom. So what's the concern here? Now, with such drastic measures being imposed so widely and on such short notice, the concern is that the COVID-19 precedent, which has allowed the suspension of a wide range of human rights in a desperate attempt to curb the spread of the pandemic, is a dangerous one. Insufficient thought is being given to the effects of the policies being put in place. And in particular, the effects of these measures on the right to mental health are being overlooked, next to the harm done to the freedoms of movement, of residence, of assembly, and of association. So now I'll hand it over to my colleague, Eric, to tell you a bit more about the right to mental health.
Thanks, Daisy. Much has been said about how COVID-19 lockdowns have placed restrictions on civil and political rights, such as freedoms of association, of residence, of assembly, and of movement. By contrast, restrictions placed by the lockdowns on the right to mental health have been systematically overlooked. We take in our paper a rights-based public mental health ethics perspective to study the moral implications of these lockdowns. A human rights approach to public health ethics clarifies the links between crises like pandemics and violations of common denominators of human entitlements. There is a broad consensus in the international community that a right to mental health exists. In the preamble of the Universal Declaration of Human Rights, 1948, the inherent dignity and worth of the human person is regarded as the ultimate foundation for the right to health and well-being contained in Article 25. The preamble of the Constitution of the World Health Organization, 1948, which is itself a multilateral treaty, proclaims the highest standard of health, namely a state of complete physical, mental, and social well-being as a fundamental right of every human being without distinction of race, religion, political belief, economic or social condition. Another important international legal provision on the right to mental health is Article 12 of the International Covenant on Economic, Social, and Cultural Rights, 1976, which obligates the signatory state to take reasonable steps to realize the right to mental health alongside physical health to the highest attainable standard through prevention, treatment, and control, and to create conditions conducive to access to mental health services. Daisy, the next slide, please. Thanks. It is axiomatic that mental health is foundational to the flourishing of individuals and populations. States and their governments have an obligation to eliminate grave and preventable risks to the physical, not just the physical, but also the mental health of their people. Indeed, based on the legal documents that we have seen just now, it's quite clear that governments have a duty to guard the mental health of citizens, and citizens have therefore a corresponding right to mental health that is enforceable against the state. Now, whether this right should be enforced by courts or by other bodies such as statutory watchdogs are separate questions that will not be considered in our present project. But this, nonetheless, is a very interesting question that we might explore in our future work. Now, whether one agrees with how the right to mental health is currently formulated in international law, it is difficult to deny two basic truths. First, without a minimally tolerable level of mental health, many citizens will not be able to meaningfully exercise civil and political rights, such as the freedom of speech, freedom of thought and conscience, and the right to vote and stand for elections, which are already enshrined in national constitutions and international treaties. Consequently, if governments are unwilling to discharge their duty to fulfill basic mental health needs, they will hurt democracy by suppressing democracy-enabling rights of a substantial portion of the population. Therefore, the right to mental health is inseparable from civil and political rights. Attack one and the other is usually affected as well. Second, there is no health without mental health. Neglect of the right to mental health will often result in neglect of the right to physical health as well. There is broad consensus inside and outside the WHO that mental health disorders are risk factors for communicable as well as non-communicable diseases. And persons with mental disorders are often at a greater risk of vulnerability as well. This brings us to the point that framing mental health as a right reminds governments that mental and substance misuse disorders undermine the common good, inflicting moral damage on citizens that could be mitigated by the provision of adequate mental health measures. Daisy?
Great. Thanks, Eric. So we've looked at what the right to mental health is and what it might entail. So the next question is, how might this right be violated by the state? And what we're concerned about specifically here is the failure to take necessary and appropriate steps to protect the public mental health during an emergency. And in the context of COVID-19 lockdowns, the primary concern is not with the inevitable risks to mental health that are caused by the pandemic itself, but rather that in implementing an ill-planned drastic response to the emergency, the response itself may result in harms to the public mental health. Now, we cannot be sure of the precise psychological effects of the lockdowns, although some of the colleagues here have been discussing about mental health effects of COVID generally. Past studies of quarantines provide us with useful insight into the types of effects that lockdowns might have on mental health. Now, for example, in a rapid review of 29 studies conducted by Brooks et al., it was found that most of these studies reported a series of adverse psychological effects, the impact of which was wide-ranging, substantial, and in some cases, very long-lasting. Now, in conducting their review, the authors identified several stressors during the quarantine, different quarantines that were demonstrated to have contributed to these negative psychological responses. Now, of course, we have to be careful when we're drawing parallels to the direct situation, the scale of which renders it arguably qualitatively different to any previous quarantine that has ever been studied before. It's likely that these stressors are equally, if not more, at work in this current situation. So, for example, one stressor was the length of the quarantine, with one of the reviewed studies showing that people quarantined for more than 10 days showed significantly higher post-traumatic stress symptoms than those quarantined for less than 10 days. And this is likely to be a significant stressor for individuals subjected to the current lockdowns, many of which have either been put in place indefinitely or at least extended multiple times beyond the original period, the uncertainty of which is also likely to be a source of additional anxiety. And so in the interest of time, I'm not going to go through the rest of these, but you can imagine just from looking at these why these might be stressors that might be very equally at work during the quarantine, the lockdowns, various lockdowns that have been implemented all over the world today. But what I want to talk about and focus on is, in addition to the increased mental health risk to all citizens that are subjected to lockdown measures, the more troubling aspect is perhaps the disproportionate effect that the violation that the right to mental health will have on vulnerable and disadvantaged populations, a point which has been brought out in previous presentations as well. Now, for example, low-income families who are confined to very small places, like the subdivided flats that were just talked about, will likely be confined to these very small places for lengthy periods at a time. And psychological risks of living within tight spaces are likely to be gravely exacerbated if you have no choice but to remain in that small space with a lot of family members for most of the day with no end in sight. For these families, school closures may also mean that their children are no longer receiving the school meals that they heavily depend on, which is likely a source of anxiety for parents and children alike. Those with pre-existing mental disorders are also particularly vulnerable. Fear of hospitals and clinics will likely affect the willingness of these individuals to access timely mental health care. And individuals with mental disorder will not be able to engage in many of the usual recommendations for maintaining good health, such as socialization, which will then detrimentally impact on their mental state. There are many other similarly vulnerable and disadvantaged groups. For example, lockdowns have kept those with abusive family members confined in the same living space as their abusers. The elderly and the disabled may be more likely to suffer difficulties procuring essential supplies, such as groceries and masks, in particular during periods of panic buying due to issues with mobility. Single parents are left with very few alternatives when faced with the closure of childcare facilities when they continue to work from home. The homeless, who aren't even able to enjoy the privilege of house arrest, are often confronted by the threat of prison or involuntary hospitalization. These predicaments are all likely to leave these groups with a range of adverse psychological reactions, including fear, anxiety, anger, and frustration. So we move on to some concluding thoughts. While the use of lockdown measures might be politically understandable, given the calamitous effects of the COVID-19 pandemic all over the world, the justifiability of such extreme measures cannot be taken for granted, even if they're ultimately shown to have been effective in saving large numbers of lives. Consideration needs to be given to how these measures can be implemented with the least possible limitation to the right to mental health. The lockdown is not a homogeneous measure, but one that can be implemented in a number of ways. In the extreme, coercive, restrictive, and indefinite lockdowns of hundreds of thousands of people can cause significant damage to public mental health by adding to anxiety, depression, and stress, and by failing to integrate quarantine measures with the provision of adequate humanitarian psychological first aid services, accurate health information, and baseline socioeconomic security, especially for vulnerable groups. The irony of the use of these emergency powers in the name of protecting the physical public health by displacing individuals, families, and social networks is its potential to cause a public mental health crisis, if not a devastating epidemic of mental health effects that will dwell for years in affected populations. Now, to address the risks to mental health caused by their emergency measures, governments need to design measures that target identified risks to mental health, beginning with the systematic integration of mental health emergency preparedness into their public health emergency planning and response. Measures targeting disadvantaged groups must also be implemented, such as providing shelters for those who would be at greatest risk if confined to a home setting, providing timely, supportive financial compensation measures, and providing outreach support services for both psychiatric care and daily needs. Now, thank you very much for your attention. This is the end of our presentation.
Thank you very much, Stacy and Eric. May I invite all the panelists back to this platform? So we have Professor talked about PTG, post-traumatic growth, and we get the conclusion of no pain, no gain. And then we have Dr. Chen talked about social exclusion, which will lead to mental health issue, but it can also lead to meaning in life or suicidal thoughts. We have Professor Yip talked about connection, stay connected under social isolation. We have Dr. Choi talked about mobilizing community assets to support vulnerable population. And finally, we have Daisy and Eric talked about the legal right to mental health. So here, I want to initiate a discussion, and I hope the panelists can respond to that. My question is there any synergy or what we can do from individual mental health to public health or community perspective under this social isolation, and still that can address our right to mental health?
Well, in terms of the times concern, I just like to say that I think the mental health should always be a priority and not an expendable item in any quarantine measure or policy. Because at this moment, it seems that I think they have been, it's an oversight, I think, for any policy making. And also in this so disconnected thing, everyone can do our fair share, to connect this disconnected people. Thank you.
Maybe I could also say something. I think because we are facing population aging, so relying entirely on professionals to deliver mental health services is actually no longer a viable alternative. So that's why I emphasize the community-based development approach, is because I believe that if people's mental literacy in general in the community is increased, then they could actually perform mutual help function better. So in terms of when there is another crisis or disaster, which is probably imminent in the future, that they could actually provide support for each other instead of simply relying on professionals, like a top-down approach. So we need a mutual help system that is better able to cater to each of our mental health.
So I'm in agree with the two previous speakers. So I think they, it's not just the health outcome, but also people's beliefs. So there's all kinds of beliefs people hold. Now, in time like this, I think those beliefs has a large impact on how people act, how people act towards themselves, but also towards others. So those actions tend to have various consequences. I think, some public community approach to educate people about this kind of consequences about these thoughts will be quite helpful.
Thank you, Dr. Chen.
Hi. Yeah, currently we have the so-called critical incident response team, and also in the health sector they have the major health disaster response team. But now I think what we learned from the COVID-19 is that there could be extensive lockdown for prolonged period, and our current response system really inadequate. So I think after the COVID-19, we should review our, for example, critical incident response team, how to expand that to, address the problems associated with extensive lockdown of the local community.
Thank you, Professor. So anything you want to say from Eric and Daisy?
Eric, please feel free to jump in. I feel that our presentation was mostly focusing on sort of the state's role and what the state has to provide, which is sort of slightly different from the question you posed about individual and community responses, which obviously is very, very important as well. So like previously said, there usually in a society at any given time, there probably aren't going to be enough resources to cover sort of these mental health effects on such a large scale at such a short period of time. So developing community resources to deal with these issues is very important. But I think the state arguably does have a role in the promotion of these community responses as well. Obviously, individuals and communities often do this, especially in certain societies, they take this on themselves, and they do this not as a result of any state initiatives, but because of their own personal initiatives. But as an extension of our argument, I would say that the state also has, in order to systematically integrate mental health preparedness into public health emergency responses, having these infrastructures in the community to help with these responses when they come, it is a big part of their responsibility as well.
Thank you, Daisy. Eric, you want to say something?
Yeah, and I also believe that the law has a role to play in promoting public mental health. For instance, many countries can do better by constitutionalizing the right to mental health as a legally enforceable right, which obligates the government to legislate laws that promote public mental health emergency preparedness, to provide basic mental health services, and also for a legal mechanism for citizens to enforce this right against the state.
Okay, thank you. So yeah, I'm aware of the time. Actually, in fact, mental health is actually the top issues that we need to deal with under this lockdown and social isolation. And no matter it is from individual perspective or community or public health perspective. So I have to say thank you to all the panelists for all the presentations in this section. And we are going to end this, and we will have a 10 minutes break, and the next section will be start 10 minutes later. So again, thank you for your attention. Thank you all the panelists.
Welcome back, everyone. Hope you all had a good break. Hope you've all had a good first session too. So just as a reminder, we're back with our social sciences faculty webinar, Social Distance, Social Response, Solutions and Strategies for Coping with COVID-19. I'm Keith Richburg. I'm the director of the Journalism and Media Studies Center. We're over at Elliott Hall, so we're actually the only ones not in Jockey Club Tower in the social sciences faculty. And we're here now with session 2 of our webinar today. And the topic of session 2 here is supporting yourself during COVID-19, tools and tips. And we've got a real all-star cast here to talk to you over the next couple of hours or hour and a half or so. So I think we should just get straight to it. If our guests are all, if our speakers are already here. I see Professor Choi in there in the box. So you ready to go? All right. Professor Lam is there. Shui Fong Lam is the director of the Jockey Club Peace and Awareness Mindfulness Culture in Schools Initiative and a professor in the Faculty of Social Sciences. She has won Outstanding Teachers Award and Outstanding Scholars Awards, and generally an outstanding person. You've received Knowledge Exchange Awards, and I can't think of a better person to be introducing this topic to us, which is mindfulness and stress reduction in the time of pandemic. So without further ado, I'm going to turn it over now to Professor Lam.
Now, today, my topic is in mindfulness and stress reduction in the times of pandemic. As kids just introduced me, that I am directors of the Jockey Club Peace and Awareness Mindfulness Cultures in School Initiative. We call ourselves PANDA because peace, the first letter is P, and A, which is PANDA, so that we are dependents. Okay, now that's today I would like to share with you that what mindfulness can help with the stress reductions during the pandemic. Okay, now here that's the objective for the 15 minutes would be first I would like to explore the stress reactions in the times of pandemic, and also that we'll try to see how mindfulness can reduce the stress. And at the end, I hope that I can offer a resources package on mindfulness practices to all the participants of this webinar. Okay, now, first of all, let's see what kind of stress reaction that we have in the pandemic. Here, that's the stressor that we have today would be, first of all, school suspension. And also that we would have scrambled for face masks, and we would have to stay home to work. And also there were regulations to reduce the gatherings and not the closing of the business, and then come for what will be the unemployment, and then also the financial crisis, and also the family care, and also that's the extra work. For example, like right now, during the pandemic, that we are not able to go back to school, but we have to do the seminars through the Zoom. Then all these are extra work, and I know that the staff in the faculty office all know about what we mean by extra work. Okay, now in face of all this stress, all this stressor, and then what would be our reactions? Okay, now stress is the effort used to stir up the body and adapt to the change. It is a reaction that prepare our body to vigorous action. When we come across difficulties, like the things that we encounter in the pandemic, that we usually would have the following stress reaction. First, we have the pupil dilate, and also the body volume, blood volumes increases, and the heart rate accelerates, and also that perhaps sometimes when we are under a lot of stress, we would try to go to toilet, and because when we're able to go to toilets and urinate, or maybe that we maybe lighter our body so that we can run faster. And also that our hands and the feet get cold because all the blood and oxygen go to the big muscles, not the fine muscles. For example, like to the arms or to the feet instead of to the fingers, because at that time that what you need is to run or maybe to fight. And sometimes then you will have a lot of sweating, so that if you sweat a lot, it cools your body down, and also that it helps you to avoid the grasping of your enemy or maybe the animals. Okay, now all these reactions help us to fight or to flight. Okay, now all these are adaptive. These are the reactions that help us survive. Somehow it is built in with our body so that we can cope with the stress more easily. So that in terms of dangers, challenges that we fight or we flight, we have all the muscles tense up, and all the oxygens go to the lung, and also go to the big muscles in order to fight against the animals or the beasts or enemies or to fight. Or sometimes we have just the opposite reaction, which is freeze. When we have the freeze reaction, we have just the opposite kind of the bodily sensation, that where pupils constrict, and also the blood volume decreases, and also sometimes we feel very tired, and also the blood pressure decrease, and also the sweating decreases. Sometimes people, when they are really, really frightened, they will pass out. You may wonder that how come that in front of dangers or challenges or threats, we will have such kind of reaction. Perhaps it may not be too adaptive. Okay, no, it is adaptive. Okay, now when you get frozen, that means you're listless, you pass out, your enemy may think that you already died. If you die, then they would not attack you. Okay, and even that nowadays, that may be also adapted for modern day too. For example, like if you are students, you are in the lecture hall, and then the teachers asking a question that you do not know the answers, then perhaps you will try to freeze up and looking down and would not look at your professors in order hoping that the professor would not notice you. Okay, now, so they will all know that all the reactions, no matter the fight, flight, or freeze, are adaptive. Okay, now let's look at the stressor again. In the past, in the ancient time, our ancestors, what they have to face the stressor would be like the lions, or maybe some beast, or maybe some enemies that chasing up to you. So that fight, flight, or freeze would be very proper and appropriate. But nowadays, during the pandemic, these are the stressors. Then who are we going to fight? And where do we escape? And even if we pass out, maybe the most possible outcome would be you have to be sent to the detention center to be segregated. Okay, now look like that all the fight, flight, or freeze reaction may not help us. So that in this circumstance, I hope that we can use mindfulness practices to help us to have the responses instead of reaction. When we come to reaction, that means we have no choice because we have built in. Some people will tend to fight, some people will tend to freeze, some people will tend to run away, and all this look like very automatic. It is not beyond your consciousness or even your awareness. Okay, but I hope that mindfulness can bring us some space that we can make response, purposeful responses. Okay, now I'm not saying that fight, flight, or freeze are useless. They are still useful. It still helps us to face the challenges and also face the threats. But we have to use it properly. When it is time to freeze, that means we need to be segregated and need to stay home. We're better to really freeze, not to fight against. And when it is time that we have to fight, then we really have to fight. But the problem is that when the threats or the challenges come, sometimes that we go by our tendency, and that we make the wrong reaction, or sometimes even that none of the building reactions, fight, flight, or freeze, is helpful. We have to make the 4th, 5th, or maybe the 6th reactions, which is different from fight, flight, and freeze, so that we need to have a space that we can make the response. And mindfulness can help us to do that. Okay, now, then what exactly is mindfulness that can help us to make responses, not simply reaction? Okay, now let's see the definition provided by John Kabat-Zinn. Now, John Kabat-Zinn is the founder of the modern secularized mindfulness tradition. That this is how he defined mindfulness. He said mindfulness means the awareness that arises from paying attention in a particular way on purpose, in the present moment, and non-judgmentally. Okay, now every word seems to be okay. We understand every word, but when they are put together, you totally do not know what they mean by awareness that arises from paying attention. What exactly is this? Now, because mindfulness is not something that you can understand conceptually or intellectually, as Lao Tzu has commented 2,000 years ago. What is speakable is not truth. Truth is not speakable. 道可道，非常道. So mindfulness is not something that you can understand by the definition. It is something similar to the taste of honey. If you have a friend who has never tasted honey before, and he comes to you, asks you about the taste of honey, then how would you explain to him? there's no way that you can show him, even that you get the formula of the chemical components of honey and show it to him, he still cannot understand exactly what it is. Now, what you see right now on the screen is actually the formula of mindfulness, just like the formula of the honey. You have to really taste it before you know what exactly it is and know the benefit it can bring, and how come that it would help us to make choiceful responses and not just automatic reactions. Okay, now we look at the time. I think that I do have maybe 2 or 3 minutes to do some very short and brief mindfulness practices. It is the 3-step breathing space. Okay, now let's do it now and try to experience what exactly are mindfulness practices. Okay, now if you are willing to do that, to have that exploration, so that let's sit with our shoulder relaxed and then our spine upright, and it is better to be away a little bit from the back of your chair or armchair, so that you can really sit properly with relaxed and also a dignified posture. If you would like, you may gently close your eyes. The first step, paying attention to what exactly is here in your bodily sensation. The tensions of the muscles. And also paying attention to the thoughts and the emotions at this moment. Turning towards what is going on right now at this moment in your body, in your mind. The second step, gathering the attention and awareness all the way to the breath, noticing where the breath is most vivid in your body. It may be the lower abdomen, breathing in, the lower abdomen rising up, and breathing out, the sinking of the lower abdomen. Just gathering the awareness to the breath, the in-breath and the out-breath. The whole process of the breathing. The third step, extending the awareness from the breath all the way to the entire body. Sitting here at this moment, and even to the space around you, and to the next moment of the day, bringing this clarity to the rest of the day. Now you may gently open your eyes, and then this is a very short 2 or 3 minutes, 3-step breathing space. And by coming back to our breath and having a little time for respite, that we are able to see clearly. And in fact, that's Greek learning, the classic in Confucius tradition, has said that when you are able to really be still, when you would have the stability, then you can be tranquil. When you are tranquil, you can be at ease. And when you are at ease, you can deliberate. When you can deliberate, you can attain your aims. In Chinese, it's 知止而後有定，定而後能靜，靜而後能安，安而後能慮，慮而後能得。When you have the tranquility and stability, that you can think clearly. When you are troubled by all the anger or maybe all the anxiety, you may not be able to make the right choice. So in mindfulness, we also have what we mean by the ABC. A is the awareness, and then B, that means that we live in the present moment, just focus on our breath, and with that space, we're able to make a better choice. Okay, now I'm looking at the time that at the end, I would like to offer you resources package that our projects had developed. And in this package, you can see that is a QR code. If you go to that QR code, then you will go into, okay, this page. Okay, here is it. Now, can you see that? Here is the page that you can, we have the English handbook and also the Chinese handbook. And then also we have the Putonghua practice and English practice guidance, and also the Cantonese practice guidance. Then what we encourage anyone who would like to have the tranquility and also have the time for the relaxations by browsing this resources package and download those practices and guidance for their own practice. And so that this is my sharing. Thank you. Thank you,
Professor. That was very relaxing. Thank you very much. I really enjoyed that. That was Professor Shui-Fong Lam. We'll get back to you. And don't forget, everybody listening out there in Zoom land, if you have any questions, you can put those into the Q&A box and we'll try to get to those if you can. And Professor Lam, you're going to stick around and answer some questions as well, either what comes up in the chat box or at the end of our session. So thank you for that. And let's just move on to our next presenter. If Dr. Laura is ready. Dr. Laura Meek, are you there? There you are. How are you? Dr. Laura Meek is an assistant professor in the Center for the Humanities and Medicine here at HKU. She's a medical anthropologist who researches counterfeit pharmaceuticals, politics of healing in East Africa, my old home. I lived in Nairobi, and she's doing all kinds of interdisciplinary things that she's going to tell you a little bit about here. Dr. Meek's presentation is care during COVID-19. So, wow, I see the slides are already up. You ready to go?
Yep.
All right, I'll turn it over to Dr. Laura Meek.
Thank you, Keith. Good afternoon, everyone. Thank you to Dean William Hayward, the Faculty of Social Sciences, and the rest of the organizers for inviting me to participate in this important forum. I'll begin by saying a few words about my own research, and then I'll move on to reviewing some very practical tips for how we can care for ourselves and others during the pandemic. So this image here is of stand-up Hong Kongers distributing face masks and hand sanitizer on the HKU campus back in February. And this is from a piece that I wrote in March with some of my colleagues, including Justin Hariyama and Ria Sinha, who works with me in the center. In our piece, we explored how disease is only the most important part of the epidemic, but as COVID-19 spreads, it fuels many other kinds of contagious forces. So there's three kinds of transmissions in particular that we wrote about in the piece. First, there's the spread of affect or emotion, in particular anxiety, panic, and fear. We documented how the constant news coverage and the compulsive draw we feel to be checking social media every second of every day ends up exacerbating these harmful affects. And then secondly, we analyzed how the so-called infodemic exacerbates these issues as we feel stress from an overabundance of information and uncertainties around which information is accurate and reliable or not. And the third concern that we noted had to do with how these issues are worsened by the fact that many people don't trust the government of Hong Kong right now. So this is something we found, for instance, when we conducted ethnographic fieldwork at protests against new quarantine centers around the city. And we concluded that although the pandemic will inevitably cause negative affects, this is exacerbated by the infodemic, which we'll be hearing more about in a few minutes, and by the political situation. So in light of such developments, it's crucial that we contribute to practical, meaningful steps to take care of ourselves, our students, and our wider communities. And this is why I really appreciate the opportunity to join this forum today. And to this end, I will be discussing some concrete recommendations from the Anthropology of Mental Health Interest Group. This is a subgroup within the Society for Medical Anthropology, of which I'm a board member. The Anthropology of Mental Health Interest Group released a statement in late March entitled, "This is Not Fine, It's okay if you're not fine. So as you can tell from the title, they were highlighting the fact that it's normal to feel sad, stressed, confused, scared, or angry during a crisis, and that we need to acknowledge these negative feelings and find ways to cope with them. So I'll be reviewing 4 of the suggestions they made for how to cope with those feelings. The first is to adjust your expectations of yourselves and others. So as we face what's likely going to be multiple waves of working from home, we also need to recognize that not everyone has access to the internets in their homes, and that not all homes are safe places. Many people, including students, are experiencing chronic displacement as a result of this, and rates of domestic violence are reported to have increased around the world. So we need to think carefully about all of the labor that we demand from those around us right now, and try to avoid unnecessarily burdening individuals who are already in precarious positions. In terms of our own lives, we should also tell ourselves that it's all right not to be productive right now. Give yourself permission to slow down. Some of us are worried about family members who are immunocompromised or at risk of becoming ill. You might be a primary caretaker in your home or needing to homeschool your children, all the while doing your own job at the same time. Or you might have pre-existing mental health conditions that are exacerbated by the fact that everything feels out of control right now. So take all of this into account and adjust the expectations you have for yourselves, your colleagues, and others. The second suggestion is to accept that everyone is going to be coping differently. Make space for the fact that what is working for your friends and your family may not be what works for you. So you may find that what helps you the most is maybe guided meditation and deep breathing, but maybe what helps someone else the most is just keeping to a very rigorous schedule. So we need to hold space for the fact that even though we are all in this experience together, we are all experiencing it differently and in our own way. Thirdly, the first step in actually giving care to others is just to listen to them. Ask non-judgmental, thoughtful questions about others and your own needs. So as someone who collects other stories as part of my research, I can tell you from experience that just letting someone talk and share their story with you is a very powerful thing. People need to feel heard in their fear, their grief, and their anger. And that's something that we can all do for one another right now. I'll share with you 3 tips that I've learned over the course of my research for how to do this well. The first is that when responding to something someone has shared with you, try not to minimize it by saying things like, oh, well, everyone is having a tough time right now, or other people are struggling even more than that. We might think that putting a positive spin on things is going to help, but it can come across as minimizing and diminishing others' suffering and feelings. So the most important thing to do is to affirm what other people are feeling and tell them that what they're experiencing is valid. Secondly, try not to immediately jump into problem solving. Ask your loved ones how you can support them. It might be that they will welcome your solutions, but it may also be that they just want someone to talk to and to listen to them. So let your loved ones tell you what they need. And then finally, also be transparent about your own state of mind, your own capacities in that moment and what you need. If you're having a tough time and can't talk about certain subjects, you're allowed to set up those boundaries. And if you're also struggling, communicate that. Fourth, phone a friend or family member who may be feeling isolated. As we heard earlier, there's a lot of research showing that social isolation and even loneliness itself is linked to all sorts of mental health risks. It's also linked to physical risk, from heart disease to weakened immune system. So it's really important that we reach out and connect with others right now. And this next set of steps, meaningful steps to take to make life more manageable, comes from the American Psychological Association, which has produced a list of things that we can do in our everyday lives to cope with the pandemic. I've put the website down there if you'd like to look up more of their tips. I'll just be reviewing 4 of them. So the first is reduce your exposure to negative media. So too much media of any kind can undermine our mental health. And some studies suggest that social media escalates anxiety more than traditional media. Secondly, make a schedule. This is important because feeling like a lack of control can fuel stress. And making a schedule is one way to gain back a sense of control in our lives. Third, spend time in nature. So there's a great deal of research about how exposure to green spaces is beneficial for our mental health. And this is true without having to go out into the wilderness. Even if you're in an urban park that has trees in it, you can get these beneficial effects. And then fourth, keep a journal. This is especially a useful tip if you find that your mind is whirling with stress before bedtime. You can try taking a pen and paper to bed and just write down your worries as they come to you. Just the act of writing down what you're worried about can often help calm your mind. And then my last suggestion is help yourselves through helping others. So helping others can have a profoundly positive impact on your own sense of well-being. And I've listed here 2 organizations in Hong Kong that you can get involved with. Crossroads Foundation is an NGO that helps people locally in Hong Kong as well as globally. Right now, they're accepting donations of masks, sanitizer, gloves, and other protective gear. You can also donate your old computers and they'll refurbish them and give them to children whose families can't afford a computer. This will let children access their school's remote learning programs. The other organization here, Impact Hong Kong, helps homeless individuals. And I've included a link here to their activity calendar with a schedule of their upcoming kindness walks. These are walks that you can join to help hand out face masks, food and water, and even temporary beds among the homeless community. So again, it sounds counterintuitive, but helping other people is also a great way to improve your own sense of well-being. And that's my last tip. Thank you very much for your time and attention.
Thank you very much, Dr. Laura Meek. That was really, really interesting. I was actually taking notes while you were speaking there. So, you know, one of the advantages of this horrible crisis that we're in here is that, just like you mentioned, the phone a friend or a family member, I've actually been keeping a lot more touch with friends and family members because we've discovered Zoom, and we've been having Zoom meetings all over the world with various friends who are scattered around. And it's really kind of nice to meet up with people who you might not ordinarily pick up the phone or even see. And now we're having these FaceTime meetings, et cetera. And then among your meaningful steps, I was saying, you know, you turn off CNN, you know, it's it's on 24/7 and it's always telling you the worst news. So thank you for that. I'm sure you'll get a lot of questions in the question box. And again, for all of you out there in the audience, if you've got some questions for any of our panelists, you can put those in the question box and we'll get to you. But at the moment, we've got to get to our next speaker because we want to keep on to our schedule. Dr. Chan YC is going to talk to us about some tips and tools for maintaining our physical and mental health and our sleep and our physical wellness. Dr. Chan is an assistant professor in the psychology department here at HKU in the Faculty of Social Sciences. She's also an adjunct assistant professor in the Department of Psychiatry at Dartmouth College in New Hampshire. So she's going to maybe explain how she can sleep as she goes between Dartmouth and Hong Kong. And she directs the Sleep Self-Regulation and Health Research Laboratory. And she's going to talk to us about maintaining mental and physical wellness during COVID-19. So Dr. Chan, I see your slides are up and you're ready to go.
Thanks for having me today. I'm happy to share some tips and tools for maintaining your mental and physical wellness during the pandemic. I'm sure a lot of people, including myself, might be asking this question for months. Is it over yet? So you might feel sick and tired of this new COVID-19 lifestyle. You might start noticing that your mood might, be affected as a result, or your sleep might change, or some of your health behaviors might also change. Indeed, in the past few months, we see different reactions at different stages of the pandemic. From the very beginning, when we see a lot of panicky reactions to COVID-19, worrying about getting the virus, concern about safety, to now, after several months of social distancing, a lot of people are noticing that the mood is affected, perhaps not just because of the fear about the virus, but also from the loneliness or social isolation resulted from the pandemic. And also our sleep might be affected, and health behaviors could also change as a result, such as our eating behavior, our exercise routines, or our drinking, smoking habits could be impacted as well. So some of these disturbances and changes may go away as the pandemic goes away or when the situation is more under control. But for some people, these short-term disturbances or changes could lead to longer-term problems such as depression, insomnia, or unhealthy lifestyle habits that could lead to increased risk for a number of physical illnesses. Especially for those individuals who may not have effective coping strategies to manage some of these changes and disturbances. So in the interest of time, I will focus specifically on sleep during this presentation because sleep is closely related to both our mental health and our physical wellness. First, I want to give you a very quick view of some recent findings from my lab. So we did a survey, an online survey asking about 1,000 adults, their sleep disturbances and their mood disturbances. And we're seeing that 80% of them reported significant sleep disturbances compared to 40% observed in previous studies in similar populations. We also see 70% of them reporting some levels of insomnia and over 60% of them reporting some levels of depression and anxiety, and close to half of them actually have, report moderate to severe levels of depression and anxiety. While, granted, this survey, we recruited a convenient sample, so it's possible that participants who responded to the survey are those who have elevated symptoms, but still, these numbers are very high. And as I mentioned, some of these symptoms could go away as the pandemic is over or when it's over. But for some individuals, these symptoms could develop into more chronic problems, such as chronic insomnia. So chronic insomnia refers to difficulty in initiating sleep or maintaining sleep, or waking up too early in the morning and not being able to fall back asleep, or having non-restorative sleep not due to other medical illnesses for 3 or more times per week, lasting for 3 months, often associated with daytime impairments and distress. Typically, the prevalence of chronic insomnia is roughly 10 to 30%, but a lot more people experience some form of acute sleep disturbances at some point in their life. And often these acute sleep disturbances are triggered by either some stressful events or a change in our habits or our daily routines, such as what we are experiencing right now. And these acute sleep disturbances could go away when the stressful events goes away, or when we are more adjusted to the new routines. However, for some people, especially those who respond to these acute sleep disturbances with not very effective or even maladaptive coping strategies, could be more likely to develop chronic insomnia. And I'll talk more about what is considered maladaptive coping to acute sleep disturbances and what would be more effective. And first of all, I want to explain a little bit how sleep is regulated. Our sleep is regulated primarily by 2 mechanisms, circadian rhythm and sleep drive. And also our sleep is heavily impacted by our arousal levels, especially during nighttime, before bed, or during sleep. Circadian rhythm refers to what we sometimes call an internal clock or a biological clock. It regulates our sleep and wake cycle, and it's also highly responsive to external light. So if you have ever experienced jet lag, you would know the power of circadian rhythm. When you try to sleep, let's say when you travel to another time zone, and when you try to sleep at a time that you're typically awake, or when you try to stay awake when you're typically asleep, you would have a lot of trouble. This is because our internal clock is misaligned with the external environment. This is what we call jet lag. Right now, I'm sure in the past few months, most of us aren't traveling, so we're not going across time zones and we're staying in the same time zone, but that could be things that we are doing that could disrupt our circadian rhythm, such as waking up at different times every day. Because of the lockdown, so a lot of people might not be going to work or not going to school. And so it's easy for us to stop waking up at the same time. And when we wake up at different times every day, we're exposed to light in a different schedule at different times. And that sends signals to our brain, suggesting as if we were in a different time zone. So in a way, we're creating artificial jet lag by having an irregular sleep schedule, especially irregular wake time. Also, because of the social distancing, a lot of us are staying at home a lot more. And so that could significantly decrease our exposure to light during the day. And also, we use electronic devices, throughout the day and night. And so too much light exposure before bedtime could also affect, our circadian rhythm. And so in order to allow your circadian rhythm to function to its optimal, you're recommended to wake up at the same time every day. And it also helps if you have a daily routine. In fact, a lot of more recent research has shown that our eating could also have an impact on our circadian rhythm. So if we keep a more regular eating routine or schedule, it also helps us maintain or protect our circadian rhythm. Also avoid screen time before bed. So when we're exposed to screens, so we're exposed to light, especially blue light, that could suppress the release of some sleep hormones that promote sleep. So try to avoid sleep time right before bedtime. The other mechanism that regulates sleep is our sleep drive. It refers to our sleep needs, the need for us to be asleep. So it varies across individuals. Typically for an adult, the recommended sleep duration is between 7 to 9 hours. It's not the more the better, it's about getting what you need. Sleep drive, often it's a function of our activity levels. And so during this pandemic, I think a lot of people have a significant reduction of their daytime activities. And what that does is that it could significantly reduces our sleep drive. And if we try to sleep as much as we used to, but our sleep drive isn't as high as it used to be because of a reduction of activities, we could experience some difficulties sleeping. Also, when people start experiencing some initial sleep disturbances, some people would respond by taking naps because they feel tired during the day. However, naps is like, it takes away your sleep drive, especially if you take naps in late afternoon or the evening. It's kind of like when you snack before a meal. It takes away your appetite, and if you nap before, close to your bedtime, it takes away your sleep drive. And so you're recommended to stay active, even during this pandemic. As right now, the lockdown measures seem to be easing, so it might be easier for us to stay active. Or even if you stay inside a lot, it's important to keep a routine of daily activities, to maintain your sleep drive. And also to avoid naps. And if you really need to nap, try to do it early in the day and limit it to no more than an hour. And sometimes there are other, reasons. So there are factors or things that we do that can elevate our arousal, leading to, difficulty sleeping. For instance, too much caffeine. So it's pretty typical that people respond to initial sleep disturbances by consuming more caffeine because that might help you feel better during the day. However, caffeine is a stimulant and it counteracts our sleep drive, and it takes time to metabolize. Typically, it has a half-life of 5 hours, meaning that it doesn't get completely metabolized, until after 10 hours. And the more you drink, the more, the longer it takes for it to get metabolized. Also, if we engage in overly stimulating activities before bedtime, it could also elevate our arousal and make it harder for us to fall asleep. For instance, a lot of speakers have mentioned that, watching news these days could be very stressful, and you may want to avoid it close to bedtime. And also when people start feeling or not, sleeping as well, some people start to get really worried or frustrated about not being able to sleep. And this worry or frustration, elevates your arousal, especially when you're trying to sleep, and that isn't helping. It's only going to cause more difficulties. And also some people might start looking at the clock a lot during, when they're in bed, when they're trying to see, am I falling asleep yet? Or how much have I slept? Clearly this is really not helping because it's creating more frustration and making you feel more alert when you're supposed to feel more relaxed and less aroused. And also for those who have, developed more long-term sleep problems, often they experience something called conditioned arousal. And what that means is that refers to the arousal that we experience that is specifically became associated with your sleep environment. Often this is a consequence of, as spending too much time in bed not sleeping. For instance, too much time in bed trying to sleep, tossing and turning, or doing other activities in bed. And conditioned arousal, often maintains, our sleep problems. And so the recommendation is to try to create an hour of wind down period before your bedtime to allow yourself to engage in more relaxing and pleasurable activities, and also go to bed only when you're sleepy. And if you're doing, some of the recommendations such as waking up at the same time every day, and also if you're creating this, relaxation period before bed and you're not engaging in other, behaviors that are creating unnecessary arousal, you should feel sleepy at about the same time every night. But if you occasionally are not feeling sleepy, you're not recommended to force yourself to sleep or to stay in bed at a certain time while you're not ready to sleep. You should avoid stimulating activities before bedtime, avoid caffeine afternoon, make sure you reserve the bed for sleep only. And I want to take maybe the last minute to just show you some findings that, from the survey. We asked the respondents, what would they do for their sleep problem? What kind of help would they seek? A lot of them reported that they will seek online resources or ask their friends and family. Not many people, chose going to professionals. A lot of them recognize that stress management and exercise, could be effective for helping them improve their sleep, but not a lot of people recognize that cognitive behavioral therapy, you can see here, is an effective treatment for insomnia. In fact, CBTI is recommended as the first-line treatment of insomnia by many health organizations worldwide. This is, we don't have time to talk more about it, but for those of you who have experienced sleep problems, you can try some of those recommendations. I suggested, and if it still doesn't work, don't worry. They're, effective treatment for insomnia, or you can always go to your doctor and just at least figure out if these problems are insomnia or if they are due to other, problems. And that's all for my presentation today. Thank you.
Great. Thank you, Dr. Chan. That was really interesting. I was taking notes the whole time and I realized I've been doing everything wrong. So I've been napping, I've been drinking coffee, and I lie in bed reading through all the CNN news reports before I try to go to sleep. And then I can't go to sleep reading all the news out of New York and Washington, D.C. and Florida. So thank you for these tips. I will put down the coffee and put down the device and the blue screen. I'm sure you'll get some questions for others who are looking for tips too. So again, put those questions into the question box on their screen here. Please send those to us. We can answer those privately, or we can wait till the end and bring in the whole group. But in the meantime, let's move on to our next speaker. Masato, are you there?
Yeah, I'm here.
All right, he's here. This is Dr. Masato Kajimoto, who's familiar to us over here because he's part of our Journalism and Media Studies Center here at Elliott Hall. Dr. Masato Kajimoto is an assistant professor of practice here at the JMSC, and he's been our leading expert on news literacy initiatives and international collaborator with educators and journalists and internet organizations all over the region, teaching basically how you can find fake news and disinformation and how to combat it, and really trying to extend news literacy, which is incredibly important now as we're getting so much fake news coming out about this pandemic. And his topic today is going to be news literacy, how to be a discerning media consumer to fight COVID-19 misinformation or infodemic. So Masato, I'll turn it over to you.
All right. Well, thank you, Keith. My sleep drive is kicking in, but I try to stay awake, and I'll be quick. Well, thanks again for having me. My presentation is slightly probably different from other colleagues who are mostly concerned about a psychological effect of COVID-19 on individuals. I'm more talking about the social consequences of misinformation and disinformation surrounding this particular virus and the pandemic. So infodemic is the word used by World Health Organization in February, and they said we are not just fighting an epidemic, we are fighting infodemic, meaning health authorities and medical professionals are also seeing this as a problem. And I said, I see it from a societal point of view. What does infodemic is doing to us? There are lots of serious issues arise from this infodemic. So for example, this article shows how in Iran, many people believed in fake cure. They believed that industry level sanitizer is gonna help them prevent them from getting coronavirus. So they had those things and died. We talked about suicide already in the first session. In India, many people killed themselves. And at least I know that some of them self-diagnosed themselves, believing that they have COVID-19. And that was one of the reasons why they decided to end their lives. And that's a serious consequence of believing in misinformation. Also in India, this particular pandemic is used against religious minorities. So we also took, some of my colleagues also already talked about this, but infodemic is also used and weaponized against underprivileged people and minority groups around the world. Sometimes academics also take advantage of the situation and publish something that is very questionable. And because it's newsworthy, it's in the news media everywhere, and people believe those. And this happened in Tokyo, where somebody who was sort of running was being attacked because many people saw this news and believed that they are potentially spreading viruses as well. Lots of scams. This particular headline comes from a US News article, but even in Hong Kong, we have seen dodgy people selling masks on Facebook and they never arrive. There are lots of questionable products being sold in Hong Kong that claim to prevent or claim to sanitize the air surrounding you or disinfect the air, which I don't think there's any scientific evidence of that, but there are lots of scams. And this one actually comes from Hong Kong. And you may see, well, you know, this is harmless. It's not quite harmless because many people actually delay their treatment or delay going to see a doctor or specialist when they see this kind of misinformation. They say, yeah, I'm a bit feverish, but why don't we try this I saw on the internet? Let's mix Schweppes soda with lemonade and see what happens. So instead of going to see a medical help, they wait another 3 days, 5 days, potentially infecting more people. So there are serious consequences if there are so much misinformation on this topic. And that is the reason why WHO says, I think infodemic is something that we should take seriously. And this taxonomy is work in progress, but I have been monitoring what sort of misinformation and disinformation is going around the world. And there are 6 types that we have identified. And just like many colleagues said previously, misinformation feeds on people's anxiety, fear, and panic, and also their curiosity. Because there are so many unknown factors about COVID-19, our desire to know more, our desire to, well, calm down or relax or to be in the position of controlling ourselves, we need information. And misinformation thrives because they feed on those fears and anxiety and curiosity. So if you look at the types of misinformation, they often comes from the questions that probably every one of us has. The origin of virus, where does it come from? Who's spreading this? Who is responsible for this? You know, what are the symptoms? Do I have it? Does my father have it? Do my kids have it? So I don't want to go into the details, but all those types of misinformation, again, this taxonomy is work in progress. But if you analyze what types of misinformation is spreading in our society, you can kind of see what sort of questions we are trying to answer by ourselves. And those misinformation actually answers those questions. Should I wear masks or not? Can I reuse the masks or not? Everybody wants to know. So if somebody claims that here's the definite answer for you, you kind of want to hang on to that. And I think that sort of psychological aspect of misinformation is something that I want to be talking about today. So why do we believe and share misinformation? Again, this has already been covered, so I'm going to be really quick. It's a very natural and biological reaction. This slide I stole from PBS TV news programs about talking about misinformation. That part of the brain that you see on the screen, the prefrontal cortex, that's the part of the brain that gets activated when you're thinking rationally and logically. So when you're trying to solve math problems or doing puzzles, that part of the brain is being activated. But if you're processing information emotionally, or rather reacting to information emotionally, different parts of the brain get activated. When this part of the brain gets activated, your body biologically produces more dopamine. In other words, you feel more excited. You feel probably sad, happy, whatever the emotional reaction is, it makes you feel more alive, right? And this is the problem, misinformation. Oftentimes, fake news is much juicier than straightforward, plain news items. That's one of the main reasons why it's hard to eradicate, hard to combat misinformation. Now, there are, I said 6 types of misinformation, but Hong Kong in particular, if you observe and monitor what's going on in Hong Kong, majority of the misinformation that might have social consequences in our view is actually very political. I ran this project with the students to fact check potentially harmful misinformation that people are sharing in Hong Kong. And in the past few months, most of the misinformation that we fact checked was political. Oftentimes they're attacking Chinese authorities and WHO, saying that they're colluding, they're not trying to help people, but they're trying to help themselves. There's a story about how Chinese government is neglecting family members, and this particular news story is about how this family was discovered dead in an apartment, which was not true. I mean, they were dead, but because it was a carbon monoxide poisoning, not COVID-19. So there are stories after stories like this. This story is about how people in Italy are now rising against China. And this story is about Americans spreading viruses in China, in Taiwan, in Hong Kong. So lots of misinformation that we see are very political. And here is a summary of what I have said in the last 10 minutes or so. So infodemic thrives because it feeds on our desire to know more. And when there's not much established facts, we are willing to believe or at least entertain the possibility of that particular information. And when you're doing so, you have another desire to share the information because like I said, everybody is curious, everybody wants to know more. So naturally, as a social being, we want to share that information. The problem is when it comes to political topics, it polarizes our society even more. Misinformation doesn't necessarily divide us, but if it's striking on already divided political spectrum that we have, it really aggravates the problem we are having. And I think that's one of the major issues that we are seeing in Hong Kong. Another thing, psychologically, if you look at each piece of information, the misinformation, you realize that we don't really care if every single thing we see in media is true or not. Oftentimes we judge whether the story is true or not by interpreting underlying messages. So if you see a video of police officers in Wuhan beating up people in the street, you may think that, well, this may not be true. This might come from actually a TV drama or something. I'm suspicious. Even if you think rationally like that, you say, but this could be happening in China. So you may think that that particular fact may not be factual, but you think, well, underlying message is true. Chinese government is all horrible and they might be doing this already anyway, even if this video is fake. That doesn't mean this is not happening. So you sort of rationalize by yourself to interpret the misinformation and believing that there is a truth in it, even though each piece of information can be not quite true. So what can we do? The next 3-4 minutes, my practical tips. We are part of this global alliance against COVID-19 misinformation. It's organized by International Fact-Checking Network. They have chatbot on WhatsApp. So if you go to that website address that I show on the screen, you add IFCN as your friend on WhatsApp, and it's a bot. So if you type keyword, it searches more than 5,000 fact-checking stories we have now in the database. So it searches the database, and if that particular fact has already been fact-checked, you will get an immediate return from the chatbot. But anyway, here's a small tips that I can share today. If you see a photo or video, suspect manipulation. Believe that it's been photoshopped. Believe that video has been edited. So one thing I learned by doing fact-checking project with the students is that photos and videos, seeing is no longer believing. Your default reaction is, this is not true, unless I can prove it's true. So photos and videos, before you share it, make sure that it's really, really true. Your default reaction should be, this is not true. Now, I said IFCN has a robust database already. We've been doing this for the last 3-4 months. But if you get no results in our chatbot, then you can go to Google and type hoax or false to the keywords and see if there are some other fact-checked news stories already out there. If your information you are dealing with is medical advice or scientific knowledge, I would encourage you to find authoritative sources who agree with that. So let's say, can we recycle masks? That's an information you want to know more. What do professors from Hong Kong U School of Medicine say? Did they comment on this? That's the way to sort of look for more information. So authoritative sources, do they agree with the information you have right now? And you see sensational wordings, emotional language, promotional writing. Like I said, misinformation has a big psychological aspect to it. One thing we have to know is that all of us has our own beliefs and biases, and emotional languages and sensational wordings are trying to take advantage of that emotional reactions to information, because again, different parts of the brain kicks in, and we are biologically a bit more excited when we see that kind of information. So be aware of that. And continue on, 30 more seconds, I guess. And also it's important to know who is sharing it. There are certain people we know in our families and friend circles who shares everything. They just share everything. So if they do that, and obviously under the current situation, lots of things might be questionable. So who is actually sharing it? Can you really trust everything this person shares? And another thing you can ask yourself is, who is the original author? Your friends are not expert in many things and not everything. So if this person shares a lot of things, then you should see, okay, what's the origin of this particular story? So going back to the origin is good. And before you share, oftentimes this is where the news media is also guilty. You know, headline often is written to attract people's attention. And the first few paragraphs has the juicy details, but the rest is more mundane details and context. But those are actually the most important things for news audience. So before you share, read everything, watch all the videos before jumping into conclusion. And if it's a very strong political angle to the information, think about, okay, which part is fact and which part is opinion. Breaking news situation, we have been having constant breaking news situations for the last few months. So there are lots of things that journalists didn't have time to fact check. So wait until other journalists are also checking that information. And if you are curious, we do teach fact checking, and we provide lots of online tools and techniques. So check out our website as well. And that's it from me.
Thank you very much, Masato. That was really, really interesting. Do check out the NALab website or come to the jmsc.hku.hk website. Check out what we're doing and what Dr. Kajimoto is doing in fact checking. There's a lot going on here. And if you have any questions, please do put those in the chat box. Maybe you saw something and you want to know if it's true. If it's true that drinking water solves the virus, or please don't drink bleach or any household detergents. And our last speaker, I believe, yes, our last speaker of the day, Dr. Paul Wong. Dr. Wong is an associate professor in the Department of Social Work and Social Administration. He's an honorary fellow for the Hong Kong Jockey Club Center for Suicide Research. He's published more than 70 academic articles, and he's really been involved in suicide prevention and mental health promotion and practice in Hong Kong since 2003. He's going to talk to us about the adverse mental effects to people's psychological and social well-being from lockdowns, quarantine, self-isolation, and particularly the school closures that we've all been dealing with here since Chinese New Year. And so he's going to bring it home for us here. And please do put any questions you have for any of our panelists there into the chat box or into the question box, and we'll get to those at the end. We'll save some time for questions. I've got many questions for all of the panelists here as well. So if you're ready, Dr. Wong, are you ready to go?
So thank you for the faculty for organizing this sharing in a wonderful afternoon. I am sharing with you my team and the efforts that we are doing with the school lockdown for the primary school students. So thank you for Ptsd Foundation for funding our program. This is a 3-year program. It's actually called the Competence in Active Resilience for Kids. The actual name of the project is called Promotion of Empathy and Prosocial Behavior among primary 2 and 3 children. We are giving them 6 sections of human education and social and emotional learning curriculum. And these are all the NGOs or the animal related organizations that we work with. So the 4 of them, we thank them sincerely. So, and then we have the team members and Rose and Kathy and Joe and Miss Lee. They all contributed so much into this project. So the project before the pandemic, the main objectives are to enhance the social and emotional competence of our primary students, and to hopefully enhance their animal directed empathy into the human directed empathy, hoping that if they love the animals and they cherish life, so that they can transfer that into human beings. And hopefully, and there's one thing that we really want to do is to enhance the reading motivations and reading skills. For those who have not much understanding of what social emotional learning is, the definition of social emotional learning is the process through which children and adults understand and manage emotions. They set positive goals, feel and show empathy for others, establish and maintain positive relationships. So during this pandemic and the social unrest period, this SEL is crucial for our young people. So in the project before the pandemic, we go to schools and then we teach them some basic psychological understanding of social emotional learning. And then we have a section that the kids actually read some of our self-developed books to dogs. And that's the volunteers, they are the dog handlers, and the kids actually love them. And they write letters and postcards and thank the dogs and the handlers. And these are the storybooks that we created ourselves. We have 6 storybooks that basically match with the social emotional learning curriculum. And these books are based on real stories. So these dogs, they are now trained dogs to provide the intervention for the kids. And most of them are actually adopted. So they have been through a lot of difficult times before they were adopted, and then even after adopted, they have a lot of difficulties of being a pet in a sense. So we learn from their experience, and then we create the books for the kids. So that's one really famous statement since January. Our Education Bureau says that suspending classes without suspending learning seems to be the motto during the pandemic. Agree, it's important, but the social learning opportunities and the connectedness and playing with the same age of peers while they are at schools are equally important. And according to the founder of the social and emotional learning of the center, she says that when physical distancing deemed necessary during our time now, social and emotional connectedness is even more critical. So we are social animals, so we need to be connected with people regardless. So hence because we can't go to schools, we have to translate the caring kids into an online mode. The primary aim of our online mode is to provide a safe platform. I'm sure many of you know the debates about using Zoom and the privacy and the issues. So we hope that we can do that safe platform so that we can connect the students and the families and the school and the community in one go. So too much talking, so I'm going to show you a video of one of our sections that online that we bring the principal, the teachers and the students and the parents together. Actually, that is something that we couldn't do before the pandemic, but now we are bringing all these stakeholders together. So it's in Cantonese. I'm sorry if you cannot really understand Cantonese, but let's see.
你好，大家喺邊？辛唔辛苦啊？呢段時間喺屋企，
唔算太辛苦 ，not very
好辛苦。見到啲同學仔啊，
唔算好辛苦。
想唔想出去玩啊
？Very 想。
屋企人俾唔俾你出去玩㗎？
唔俾啊！唔俾。
咁你哋想唔想出去玩啊？
想。
今日咧就
寫完功課啊。
係咪啊？今日透過 Zoom 咧，你睇下啲同學仔先，跟住落去咧，好快我哋就會有得出去玩㗎啦。
Oh yeah！Hello。
今日做咩打針？ 哦，佢今日打一年一次嗰啲針。
OK。
佢痛唔痛啊？
佢好乖喎，好叻喎。你哋食咗飯未？食晒啦。
食咗啦。
食咗啦。呢排屋企做乜嘢多啊？你哋？
做功課。你哋跟唔跟得到啊？我做晒喎，日日都。功課都唔該。
活依然有同我行多咗山，
多過以前啦，係咪啊？
係啦。
唔該，樹啊。
好多人。
好多人啊！
係啊。翻嚟我都會同佢哋喺啲手腳嗰度噴翻啲消毒液嘅。
有。
出街啊！你出街
我咪成日出街。
有冇對香港影住嚟㗎？有冇防疫措施？
出街食飯。係啊，你哋
出街食飯啊？
我都係會。係啊，成日都係會。有時會啊。
之前有冇戴口罩啊？
有時會出街食飯。
係啊。你哋啊，你啲老師打電話去咧，有啲同學話咧唔開心冇得出去咯。但係呢排你哋要忍下，知唔知啊？為咗安全，寧願多啲留喺屋企，過咗呢個疫情先算，知唔知啊？
知道。都好多時間。早起身，有時冇嘢。
好悶冇
嘢。我真係好冇嘢做。畫圖畫。
打機，仲有咧？
畫圖畫。
畫圖畫，有冇得俾我哋睇下？好啊。
畫圖。砌模型咯，多數都係砌模型。佢哋點啊？好開心咯，可以見到大家咯。
你哋好開心啊！
好開心，最可以見到邊個？黎老師。
係啊，見到你啊！
我咧就預備咗一個圖片俾大家喎，大家望下先喎。我咧要注重健康喎，幫大家打氣嘅，好唔好？
好。
咁咧就同學，我哋講再見先，好唔好啊？拜拜。
Okay, so thank you for your time. I hope the video can portray to you. Okay, these are the unexpected positive learning experience during this pandemic when we go to online. The wonderful thing about this online mode is to be able to let us to engage the parents and the principal and the teachers in one go. In the past, it is actually quite difficult to engage the parents within the school time. So this is actually quite meaningful. And then the parents actually know more about what we are doing with the kids, and they appreciate a lot about the stuff that we teach them. And then there's another thing that when we are doing this online, there are some children, they are afraid of dogs now because it's doing it online. It let them have a safe space for interacting with the dogs through the camera. So that's wonderful. But as Dr. Cheryl Choi shared about the digital divide, there are some underprivileged students, they are not able to access the internet and they don't have Wi-Fi and whatsoever. So because of that, we actually have developed two versions of the online caring kits. We have the live and then the pre-recorded sections. The live section is for people that they have access to the internet sufficiently. But for the pre-recorded sections, it actually let the students and the parents to access the information whenever they can if they don't have the smooth Wi-Fi at all. Okay, so these are some samples if it's being done recordedly rather than online. So thankful for the handlers. This is what they have been doing for us.
乜嘢時候係最唔開心啊？梗係爸爸媽媽唔喺身邊啦，冇人愛錫，冇飯食，俾人蝦，呢啲都會唔開心㗎。
So instead of having the dogs, the trained dogs online, they are using these pet-friendly apps to pre-record the dog's behavior so that the dogs can actually talk to the students. Because of the time issue, so I will skip through a few slides. So one thing that I think the pandemic has probably pushes us to really deep thinking about how is the future of our next generation. The sustaining learning is a crucial thing, but teaching the students about academic stuff is one thing. But in our future, when the whole world is connected with online and Zoom and Microsoft Teams, these are the 6 C's that I hope that our students could be able to practice and learn in the future. It's called character, citizenship, collaboration around the world, communication with other people, be creative, and be able to critically think about what they are doing. So these are the 6 C's for the future. And let me run up the talk with this Lancet editorial. It's actually called the Pandemic School Closures and Opportunities. We talked a lot about the risk to mental health and the obstacles and challenges during the pandemic. But if we look at the positive side, now is the best time that we listen to the creative solutions of the young people, and we empower them with the new skills to create a more robust and caring and connected society into this changed world. The world will be changed rapidly after this pandemic, so we should be ready for that. So that's all I want to share. Thank you.
I like the dogs. I think at HKU they have Jasper, the emotional support dog here, although I haven't seen him around lately. So, and want to thank, and please stay on because we'll probably have a question or two. I wanted to thank all of the panelists. It's been really, really interesting. We've got a few minutes left for a couple of questions. It's been really interesting. Professor Lam, you went first. You're still here, I believe, talking about mindfulness and giving us some ideas of some exercises that might help us there. Dr. Laura Meek came in and gave us some very useful tips for reducing stress, including phoning your friends and putting down those devices and making a schedule and keeping a journal. Then we had Dr. Chan come in and talk to us a little bit about basically sleep and how to sleep and keep your mental wellness through sleep and ways to, well, basically don't do all the things that I've been doing, like drinking a lot of coffee and watching CNN. And then we had Dr. Masato Kajimoto talk to us a little bit about the fake news and disinformation going on around the virus, and don't believe everything you read in social media. And then thank you, Dr. Paul Wong, for wrapping it up there with that really interesting talk about how basically schools and young people dealing with this kind of lockdown and the shutdown of schools. That's very, very interesting. I know that basically for especially the younger kids, among other things, older kids can somewhat deal with it because they can, they can do some lessons and really can keep to a schedule online more if you're in high school or so. But for the young kids, I mean, they really do miss their friends. They miss their friends, they miss their teachers, they miss that routine of putting on their uniforms and going to school. So it's really kind of interesting. If you have any more questions, please do. Put those into the question box down there on your screens. You can see, you can type those out, or you can try to request to ask it live if you want. I do have one question here for Dr. Masato Kajimoto, if you're here. It says that Dr. Kajimoto, as a student who's interested in the media during the COVID-19 crisis, they says, I know of instances where classmates jump to conclusion after reading just one news source, and then they accuse and dismiss others' views as fake and inaccurate. And as you mentioned in your presentation, fake news circulates so very widely. They are wondering if it's better to have multiple sources on things. Basically just wondering, is it better to get multiple sources and cross-check multiple sources to help increase the political tolerance and understanding of the whole picture?
Right. I actually wrote a reply in the Q&A. Yeah, but in general, yes. If you widen your scope of media consumption, then you are exposed to different views that might change your idea about what's going on. But unfortunately, research shows that often people who believe in fake news are already doing that. So for example, if you're a big fan of Washington Post, when you watch Fox News, you are watching it to attack them. The same thing here. If you believe in conspiracy theories, you consume traditional media organizations to attack them, nitpick them, find fault with their news reports. So there are many people already doing that to attack opposing views rather than being exposed to different views. So the research shows that if you are corrected by somebody who shares the same view, you are more likely to listen to them. So instead of saying, hey, you are wrong, you say, yes, I share the same political view, but this particular thing might not be factual. So that might be more effective to, if you are trying to convince somebody, that is. Yeah. Does that make sense?
Yeah, no, absolutely. Thank you. I saw you had just written out the answer just when I was asking the question, but I thought it was a good one for the entire group to hear as well. And I wouldn't mind maybe just posing the question to the entire group here. You know, we all want to get information all the time about what's happening with COVID-19 and especially when we see what's happening around the world, including in the United States. I for one have a habit of staying up all night because that's when the United States is awake and watching the news going on. But you know, how do you both keep yourself informed about what's happening and watch those latest numbers of infections and deaths, but at the same time not overdose on this kind of news going on, which then leads to, you know, not being able to sleep and stress and wondering whether it's coming back here. I mean, you know, when you pick up the newspapers these days and the only thing on the front page of most days is all, you know, COVID-19 news, and it's all bad news. So any of you panelists who would like to take a whack at that, how do you keep yourself informed? There's no other news story in the world right now people are paying attention to. How do you unplug from that? And as several of you said, try to take a walk or reduce stress or something else. Who wants to go first? Professor Laura Meek, Dr. Meek.
Well, I can just share what I do in my family, which has been helpful, is that we take turns with whose responsibility is it to read the news for that day. And I've got a lot of siblings, so it's only my responsibility one day a week between my parents, my siblings, and my husband. And then we share with each other on WhatsApp anything that we actually need to know to stay well, not things that are just inflammatory or upsetting or shocking, just what we actually need to take care of ourselves. And only checking the news one day a week has affected me immensely. I feel so much better than I did in the beginning when I would check the news for hours in the morning and then the rest of the day be very depressed. So that's what's worked in my family, at least.
Great, thank you. Dr. Chan, would you, sorry, Dr. Lam, you want to take a crack at that? Please do, Dr. Lam first.
Okay, I think this is a matter of self-discipline. When it is the time to do mindfulness practice, then I do mindfulness practice. When this is the time for the news, then I watch the news. And I think that I go by the schedule, the time slot, to make sure that I have a balance in my life. Time for watching news, then at the time for watching news. Time for doing something good for myself, like doing the meditation. That's the time to do the meditation, and that's it.
That's good advice. Dr. Chan, how can people fall asleep when there is so much bad news swirling around? I mean, it's kind of hard to put it out of your mind, isn't it?
Right, absolutely. Well, I agree with you know, what other panelists said. You know, I think part of it is to put a time limit to it. I think it's hard to say not watch the news at all, but put a time limit on it that is reasonable. And from, you know, kind of along with what I talked about in the presentation, if you want to sleep well, try not to watch the news an hour before bedtime, because often news, it's getting really stressful these days. And absolutely don't watch the news when you're in bed. So try to, you know, watch the news early in the day, so when you're not in bed. And if you feel like it's really significantly affecting your mental health, you might really have to, you know, minimize the time and like what other panelists said, really limit it to things that are actually helping you rather than bringing you down.
Okay, thank you for that. And Dr. Paul, let me ask you one final question. I think I'm just checking to make sure. I think we've got a minute or two, a couple of minutes left. Dr. Paul Wong,
Yes.
Talk to, because you were dealing with schools, especially and students. I mean, how should one talk to children about this story where you've got hundreds of thousands of people around the world dying, a pandemic like we've never seen before, lockdowns. I mean, how do you discuss this, especially with smaller children? It must be a really difficult challenge, right? You don't want to hide things from them, right? But you don't want to scare them.
No, but we need to tell them the fact that people do die, and it's a fact, and we tell them that there's more than like 400,000 people are dying, and we just need to warn them. It's a virus that kills people, so that's why they need to be careful of their physical well-being as well as their mental well-being.
The presentation, I want to thank, I think we're probably hitting on our time, if I'm not mistaken. So I guess we're going to wrap this up now. I don't see any more questions hanging. You can reach all of our panelists, of course. You can find us all on our HKU emails. But I would like to just, first of all, thank the Faculty of Social Sciences for pulling this together, and really thank our panelists here for taking the time out to do this. Professor Shui Fong Lam, Dr. Laura Meek, Dr. Chen Y.C., Dr. Masato Kajimoto, and Dr. Paul Wong. And then for myself, Keith Richburg, over here at the Journalism and Media Studies Center. I just want to thank all of you participants. We had quite a few who stayed with us for both sessions. So thank you for staying with us. This whole session's being recorded. So if you missed any of it, or you missed part of it, or came late, or you want to recommend it to anybody, you can follow the link and then go up to watch the entire thing later, or watch any parts that you missed. We probably will be following this up at some point with this will be a part of a series of such webinars to keep everybody informed with what the social sciences faculty is doing to help you cope with COVID-19. So I think this was all fantastic. Thank you very much. Thank you for joining us. Thanks to our panelists. Thanks to Dean Will Hayward, whose goal it was to put this together, whose vision it was to do this. I think it turned out well. And thank you all for the staff over there at the Faculty of Social Sciences who put this up and got it all running smoothly and made our jobs easier over here. So again, thanks everybody for joining, and please stay in touch. Follow us on social media, follow us wherever you follow us to find out when we're going to do the next one in this series. And I'll be signing off. So thank you very much from Elliott Hall, and take care. Bye-bye.